I do
Got
have,
them?
yeah.
Okay, perfect. Got extras if you need.
Am I good to go?
We're checking why we don't have power to this
Okay.
thing, but Mike, are we okay to start? Yeah, I think we're okay.
Okay, we're gonna start. We do have quorum. Tech is here beside me doing some things, so I'm going to ignore him and proceed, which is fine. Welcome to City Hall. So good morning, my name is Councilor Chris Moyes, and I am the Chair of the Board of Health. The Board Secretary has confirmed that we have quorum, so I'll call meeting 6 of the Board of Health to order. Welcome to everyone. And in the room, we have Director Chandra Balan, we have Councilor Perks, Councilor Bravo, Councilor Zhao, and Councilor Sriskandaraja. And I was told online, we have Councilor Thompson, Councilor Director Krishner, and Director Singh. Today's meeting is being held with board members and city staff participating both by video conference and in person at City Hall in Committee Room 1. City Hall is open to the public, and anyone is welcome to attend the meeting at City Hall today. The public may continue to participate electronically by video conference. This meeting is also being live streamed online at youtube.com/Toronto City Council Live. I ask everyone for their patience with any delays and technical issues. Let me make sure my cell phone is off, because I would hate for it to go off. Okay, it's off. The clerk staff will connect all remote registered public speakers to the meeting by audio. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has also emailed the speakers list to directors. Directors, this is a paperless meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or a motion, I ask that directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. And I will now proceed with the land acknowledgement. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including Mississaugas of the Credit, the Anishwabeck, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with Mississaugas of the Credit. Today, this meeting place is still the home of many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work and live on this land. As public health professionals and members of the Board of Health, we recognize the historical and present-day traumas inflicted upon Indigenous peoples. We stand with communities and families as they mourn the loss of loved ones who were sent to residential schools and never returned. We also acknowledge our complicity in ongoing colonial violence. We commit to supporting the efforts of Indigenous groups towards reconciliation and action-oriented practices, including the equitable use of resources. We strive to learn Indigenous histories and collaborate with communities and families so we can create safe spaces that honor Indigenous cultures and ensure that Indigenous perspectives are present in our work and practices. As a Caribbean Canadian, I'm committed to continually acting in solidarity with our African, Caribbean, and Black communities, seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact our communities across Canada. As part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I wish to acknowledge those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. In support of the City of Toronto's ongoing efforts to confront anti-Black racism, I pay tribute to those ancestors of African, Caribbean, and Black origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of these interests. Right? Seeing none, we need a motion to confirm the minutes from the last Board of meeting from July 4th, 2023. Director Srish Kandaraja, so moved. Oh, he wasn't here? Councilor Bravo? Okay, all those in favor? All those opposed? Let's carry, thank you. We'll move on to the chair's remarks. So I'd like to welcome, she's not here, but I still would like to welcome Deputy Mayor Morley to the Board of Health.
She's trying to sign into WebEx, so she's doing it.
Okay, no worries. But she's our new member to the Board of Health, and so we welcome her to the Board of Health. And just arrived is Deputy Mayor Malik. Welcome, Deputy Mayor. And today is the start of Toronto Public Health Service Week. So happy TPS Week to all our staff in the public service here in Toronto. So as we start off the new school year, I'd like to acknowledge the immense dedication of Toronto Public Health staff who have been diligently working with school boards over the summer months. Toronto Public Health staff presented to the school boards about reducing the spread of respiratory viruses during the peak fall virus season. Information on the fall COVID-19 boosters, the student immunization program, and the efforts public health staff are making to catch up on school-based vaccines coming out of the pandemic. Staff will make a presentation today to provide us with an update on actions taken to address the impacts of the COVID-19 pandemic on the health of school-ages children and youth. We encourage everyone to get their flu and COVID-19 vaccines, especially those in regular contact with children, the general public, seniors, or individuals with weakened immunity. Getting a bivalent mRNA booster dose in the fall, when the respiratory season starts and the virus spreads the most, gives the best protection against the COVID-19 virus. However, infants and children between 6 months and 4 years of age are currently ineligible for these booster doses. For those ages 18 and above who, due to medical reasons or personal choice, are either unable or unwilling to receive an mRNA COVID-19 vaccine, the Novavax COVID-19 vaccine is available, given informed consent. Earlier this month, I released a statement in response to the provincial government's announcement regarding funding for local public health units. The province has restored local public health unit funding to pre-pandemic levels of 75-25 split, plus a 1% increase annually. In my statement and subsequent calls from the Chief Medical Officer, Dr. Moore, and other local health units, I express my gratitude towards the province for their investment. However, I also emphasize the critical need for funding that matches the rate of inflation at a minimum. Dr. Davila and I continue to engage in important dialogues with our provincial counterparts, advocating for increased funding and resources. So Dr. Davila will elaborate during her update, but I am very proud of the work staff have done to convene the Health and Homelessness Working Group made up of a panel of experts and individuals with living experience to provide input to the Medical Officer of Health on issues impacting those populations. Additionally, they also hosted several community engagements, consultations, and roundtables as they work to prepare the mental health, substance use, and addictions strategy. I would like to extend my heartfelt thanks to our staff for their relentless efforts and over the past few months, and acknowledge that we have an important journey ahead. I will now turn it over to Dr. Villa for her opening remarks.
Thank you, Mr. Chair, and good morning to the members of the Board of Health and to the members of the public, whether you're here with us in Committee Room 1 or joining us online. First, I would like to extend a heartfelt welcome to each of you as we convene here for our first full meeting of the board since early July. I do hope that you all had the chance to get some rest this summer and are hopefully feeling energized or re-energized as we embrace the forthcoming fall season. As we enter this fall, here at the City of Toronto, we are welcoming new leadership following the election of Mayor Chow. And echoing the chair, I would like to take a moment to acknowledge the appointment of a new member to the board, Deputy Mayor Amber Morley.
Right on time, sorry.
Perfect timing indeed. Welcome, Deputy Mayor Morley. So welcome to the board. At the outset, I also wish to echo Chair Moyes' note to recognize and celebrate that it is indeed Toronto Public Service Week. This is an opportunity to really speak to the dedication and resilience of our city's public servants. This, of course, includes the staff at Toronto Public Health who work to safeguard and promote the health of Toronto's residents. This week serves as an opportunity for all of us to acknowledge and applaud the unwavering commitment of Toronto Public Health staff and our colleagues who support our work, many of whom are in the room with us today. Along with our colleagues throughout the city, I can confirm to members of the board that Toronto Public Health staff have consistently gone above and beyond to ensure the health and well-being of our community, particularly during the last 3 years, the last very challenging 3 years that we've all faced. So I would ask if you wouldn't mind, please take a moment and join me in expressing our heartfelt gratitude to the entire Toronto Public Health team for their dedication and frankly for all that they've done over the last 3 years. Many of them are here in the room, but they are certainly sprinkled throughout the city, continuing to work hard. So thank you to the entire TPH team. And recognizing that we are seeing a change in season, there are as well with that some very distinctive public health challenges. We are going to hear, and we look forward to engaging you as members of the board today on several crucial topics and in the coming months that are vital to our operation of our local public health unit and ultimately to the well-being and health of Torontonians. As you'll see today, this will encompass discussions on our city's children and youth, on our budget, and preparations for the fall respiratory illness season, amongst others. For those that are under discussion today, for those topics that we're going to be looking at specifically today, our team has diligently prepared for these endeavors, and I'm confident that with your invaluable guidance and support, that we will successfully navigate this period. Change, as we know, presents both opportunities and challenges. So drawing from our public health practice and the lessons we've learned throughout the pandemic, we understand more than ever that we are at our collective best when we collaborate with our healthcare and community partners, with Public Health Ontario, and with other levels of government. I look forward to fortifying our partnerships and working collaboratively to address the pressing health issues that confront our city. And finally, I just wish to convey my profound appreciation for the dedication and expertise each member of this board brings to this table. Your commitment to public health and your efforts to enhance the lives of Torontonians is truly and deeply appreciated. Together, we've overcome numerous challenges, and I'm confident that we will continue to do so in the future. With that, I will turn it back to you, Mr. Chair, and look forward to the rest of the meeting.
Thank you, Dr. De Villa. So we'll review the agenda. So item HL 6.1, update on actions to address the impacts of the COVID-19 pandemic on the health of school-aged children and youth in Toronto. There is a staff presentation and registered public speaker, so I will hold it in the chair's name. Item HL 6.2, Toronto Public Health backgrounder for 2024 budget preparation. There's a staff presentation, so I will also hold this down in my name. Item HL 6.3, COVID-19 vaccine distribution to Toronto Public Health to healthcare providers. This is a staff presentation, and so I will also hold this down in my name. I also think we have one speaker for this item as well.
Item number 3, actually.
Oh, item number 3. What number? Okay.
Point of order, the line will list to speak on item number 3. I signed up earlier this morning.
It's Garrett Moore. He's registered
He's registered.
for number 3.
It's not a point of order, but you are registered. In future, speak to staff about that. So following the agenda review, continue with the first health item. Okay. Okay. So we'll go back to the top of the agenda. It's only 2 items, right? Okay. So the first item, item HL 6.1, update on actions to address the impacts of the COVID-19 pandemic and healthcare for school-aged children and youth in Toronto. I'll ask Dr. Davila to introduce the speakers.
Thank you, Mr. Chair, and good morning again, members of the Board of Health. For this item, to accompany the report, we have a presentation by my colleagues, one of our esteemed directors at Toronto Public Health, Nicole Welch, and she's joined by one of our Associate Medical Officers of Health, Dr. Vanita Dubé. So with that, I will turn it over to you, Nicole and Vanita, to take us through the presentation.
Thank you very much, and good morning. I would like to also indicate that at the end of our presentation, we do have our colleagues at the Toronto District School Board and the Toronto Catholic District School Board, the Directors of Education, Colleen Russell-Rollins and Dr. Brendan Brown, who will share a few remarks at the end of our presentation today. The purpose of this presentation is to provide the board with an update from the March 30th, 2022 report on the health impacts of the COVID-19 pandemic on children and youth, including the actions that are being employed to address the impacts on the health of school-aged children and youth, and finally, recommendations to further enhance the work of TPH and partners to improve the health of this population. Next slide, please. And next slide. Sorry, I'll remember to say next slide, Dylan. Toronto Public Health is celebrating 140 years this year, and as a result, we wanted to share some of the history of the work with this population. Early 1900s, Toronto's health and education officials began to concern ourselves with the health of children of low-income families living in the city's crowded slums. 1910, the boards of education began providing medical and dental examinations and oral health education in schools. And in 1917, the Department of Public Health assumed the responsibility of these exams and started our long history of partnership with the schools. In 1913 to 1963, the Department of Health and the Board of Education continued to work together to accommodate children with special needs, and programming tailored to their special needs. Next slide, please. So in the 1990s to present, 1990 was the year that the Ontario's Immunization of School Pupils Act became law, and school-based hepatitis B vaccines were administered in schools in 1994. In the early 2000s was the adoption of the comprehensive school health model and the introduction of school liaison nurses in our schools. 2005, school-based meningococcal vaccine program started. And in 2016, we signed the first Toronto Healthy School Strategy. 2018, there was a new school health standard that was included in the Ontario Public Health Standards. 2020 to 2023, we all know what we were doing then, and that was working on COVID. And the COVID response and child and youth response team was started in 2020 of that summer, and we responded to over 64,000 case investigations, over 36,000 contact investigations, and over 30,000 outbreak investigations. We also did numerous education sessions, including weekly principal webinars, vaccine confidence sessions with parents and students, produced many guidance documents, screening tools, and et cetera to support the schools and the school communities throughout the pandemic. In 2022, we renewed the Toronto Healthy Schools Strategy, and this is a commitment and signed by all 4 directors of the publicly funded schools in Toronto and by the Medical Officer of Health, Dr. Davila. Next slide, please. I would like to share some of the updated status of children and youth in this population, and starting with mental health promotion and well-being. 1/4 of Ontario students felt online learning from home was very or extremely difficult. Over half of Ontario students reported that the pandemic has left them feeling depressed about the future. And over 1/3 reported it made their mental health worse. It was also found that Toronto emergency room department visits related to self-harm among children and youth increased by 30% in the first year following the start of the pandemic. The data also shows that mental health concerns were especially prominent among children and youth facing barriers, including international students, students with special needs, students facing discrimination, and those families with lower household income and parental educational rates. Additionally, evidence suggests that household food insecurity is linked with negative mental health outcomes for children and youth. And we do know that 1 in 5 households in Toronto reported food insecurity within the past year. Next slide, please. Substance misuse among school-aged children and youth has remained relatively stable. 2021 Ontario Student Drug Use and Health Survey indicates that most Ontario students do not report drinking alcohol or using drugs. But for those that do report using substances among the grade 7 to 12 students, high caffeine energy drinks were used at 33.1%, alcohol at 31.8%, with 8% of students reporting binge drinking at least once in the past month. This is a slight decrease from 2019. Cannabis was reported use at 17%, and 14% of secondary school students report that they used cannabis to cope with a mental health concern at least once in the past year, which is similar to the 2019 rate. Vaping in Ontario students is about 15% in the past year. Of those that report vaping in the last year, the majority, 84%, vaped nicotine. And this is an increase of 56% from 2019. Next slide, please. In the area of physical activity, current evidence suggests physical inactivity and increased screen time as an area of concern for school-aged children and youth. 37% of Canadian youth aged 12 to 17 years are meeting the recommended 60 minutes of moderate, vigorous physical activity daily. This is down from 51% before the pandemic. And declines in physical activity were significant among Indigenous youth and immigrant youth as well. Next slide, please. Screen time. This is a topic of conversation often among this population, and the evidence shows that 88% of Canadian students spend 3 hours per day in front of a screen, and this is referring to recreational screen time. 31% spend over 5 hours on social media per day, and this is an increase from 21% in 2019. Increase in screen time often corresponds to an increase in cyberbullying. And in 2019, it was around 22% compared to 30% in 2021. Seen a slight increase there. 24% of Canadian students reported playing video games for over 5 hours per day. And this is an increase from 11% in 2019. And it results in about 20% of students meeting the criteria for having a video gaming problem. Thank you. I will turn it over to Dr. Dubé, who will continue with the presentation. Thank you.
Thank you. So moving along to talk about vaccinations and immunizations, our goal at Toronto Public Health is to continue our efforts to get us back to pre-pandemic rates and beyond. And so in the last school year, we actually made tremendous efforts, and we're trying to catch up students in grades 7 to 12. So at the end of the last school year, we had provided over 110,000 vaccines in schools to over 50,000 students through over 1,000 clinics in over 550 schools. Next slide, please. However, despite these tremendous efforts for catch-up, our vaccination rates post-pandemic are lower compared to before the pandemic. So if you look at the chart on the left, you'll see that at the end of grade 7, the vaccines that are provided to grade 7 students, meningococcal, hepatitis B, and human papillomavirus, are lower at the end of last school year compared to before the pandemic. So for meningococcal, at the end of the 2017-2018 school year, we had a rate of 86% in grade 7 students, whereas last year it was 78%. Likewise, for hepatitis B, it used to be 77% at the end of the school year, and last year it was 62.5%. And similarly, for human papillomavirus, we were at 66%, and last year we're at 57%. Next slide, please. So those school-based vaccines are still available for catch-up at our Toronto Public Health vaccination clinics. We also have routine vaccinations that are captured under Ontario's Immunization School Pupils Act. So these are the vaccines that many of us are aware of: measles, mumps, rubella, pertussis, polio, tetanus, for example. Toronto Public Health has sent out over 100,000 letters this past school year and will continue to send letters to parents and students who are outstanding for these routine and very important vaccines. Students or parents are required to report these vaccinations to Toronto Public Health or submit a valid exemption. And so it is a parent's responsibility to report if their child has been vaccinated. And we have an online tool to be able to do this called Immunization Connect. Next slide, please. Similar to the school-based vaccines, vaccine compliant rates compared to before the pandemic to where we are at right now have shown a decrease. Now, these trends are also consistent with provincial rates. They may represent an actual decrease in receiving vaccines, or they may represent a decrease in reporting vaccines. It's difficult to determine the difference through these data, but you can see that there's a substantial reduction. So for grade 2 students in the 2017-2018 school year, 78% were up to date with their school-based vaccines, and currently it's 43%. And for grade 12 students, 87% were up to date, and now it's only 22%. Next slide, please. Many of these reductions in those vaccination rates for grade 2 students, we look at them specifically because by grade 2, a child should have received their 4 to 6 years of age booster dose, and some may not have received it. And by grade 12, adolescents should have received tetanus, diphtheria, pertussis booster, and many of them may not have received it or reported it. The good news is right now, students can receive those vaccines at primary care offices. They are where these vaccines are routinely available, but we also have a City of Toronto immunization clinics. These are our MICs, known by many. They are operational 5 days a week, and we do have 4 locations that are listed there. Next slide, please. So moving along to dental and oral health. In the last school year, we gradually resumed school dental and oral health screening services. This meant that children in kindergarten, both junior and senior, and grade 2 were screened in all public schools. And there were also children in grade 7 and grade 4 and grade 7 who were screened in schools that previously were known to have higher rates of dental caries. So in total, over 70,000 children were screened the last school year. About 4,000 were identified with urgent needs, which represents just over 5%. And about over 22,000 were identified with dental concerns, and that's about 30%. So about 1 in 3 children who were screened were identified with dental concerns. Next slide, please. Our school health services will continue Toronto Public Health's coordinated role with the school boards. So all publicly funded schools have access to universal public health services. These include online curriculum supports and resources, foundations for a healthy school tools and resources. Public health nurses are assigned to schools and can do assessments, consultations, and school staff capacity building. There are also school health services that we've discussed that will be provided in schools, like oral health, immunizations, and infection prevention and control. So the school liaison public health nurses will work more intensively with schools that have increased needs to promote optimal school health outcomes for all. Next slide, please. The following health topics have been prioritized. This has been in consultation with Toronto Public Health and the school boards and schools, and they include school mental health promotion and well-being, infection prevention and control, nutrition and physical activity promotion, sexual health promotion, and substance misuse and prevention. Our vaccine preventable disease program is continuing our catch-up efforts, and dental and oral health services will continue to be screening all elementary students and invite secondary students to screening clinics. Next slide, please. We are in the fall and anticipate that fall respiratory viruses will increase, and so these are things like respiratory syncytial virus, RSV, influenza, COVID, and other viruses. We know that some of these viruses, like RSV and influenza, can be more serious in children. We look to our neighbors in the Southern Hemisphere to see what their winter season was like, to glean what we can for our coming season. And what we found was, yes, these viruses, including influenza, were more common among children, more serious among children, but the influenza strains that circulated were a good match to the vaccine, and that is the same vaccine that we will be giving. So this fall, flu and COVID boosters will be available, and it's really important that parents know to get their children and then themselves vaccinated to prevent getting very sick from these viruses. Next slide, please. So there are still some measures that we want to continue even beyond COVID, because we know that they are effective to prevent respiratory viruses like COVID and flu and RSV. And so that includes staying home when we're sick to prevent the spread of infections. And so there are screening tools that are available. The one image on the right is Toronto Public Health's adaptation of the province's guidance in their self-assessment tool. We know that cleaning hands is really important and works, covering our cough, disinfecting surfaces regularly. We know the role of good ventilation. I've mentioned staying up to date with our fall and routine vaccinations. And of course, we've learned about masks through COVID, and they may be important as we get into the season, especially for those who are at higher risk of getting very sick, especially in crowded indoor settings. Next slide, please. So in this report, the Medical Officer of Health has provided recommendations to the Board of Health. The first one being that the Board of Health request that the Medical Officer of Health to continue to work with Toronto school boards to monitor data on the ongoing health impacts of the pandemic and collaborate on joint initiatives to improve the health of school-aged children and youth. And the second, that the Board of Health request the province of Ontario to work with education system partners to address wait times and increase priority access to care for students requiring intensive mental health interventions and supports within the community that exceed those available through school systems. Next slide, please. And with that, we conclude our presentation and would like to ask our school board partners who are on the line, who have graciously joined us, to say a few words. So,
Good
not sure
morning.
who's available first. Yeah, go ahead.
Good morning. Thank you very much. It is my pleasure to be here and to take this opportunity to really express my gratitude and to affirm the responsive and intentional partnership with Toronto Public Health. It goes without saying that without the unwavering leadership of Dr. Davila and the evidence-driven advice of many of the staff at Toronto Public Health, school boards such as the Toronto District School Board would not have been able to keep schools operating and to offer effective protections against the transmission of COVID. It was an incredible collaborative effort, and thank you to all of the TPH staff who worked with us centrally, with our Board of Trustees, and most importantly with schools, students, and families. I'd like to highlight perhaps just three quick aspects of our relationship. Firstly, the Board of Health, I believe in past years, has recognized, very importantly, racism and violence as a public health issue. Youth between the ages of 12 and 16 have faced greater challenges arising from the pandemic. In particular, TDSB, like other district school boards across Ontario and North America, has seen an increase in violence and aggression. In 2023, I established an expert panel on student and staff safety. I'm very grateful for the leadership of Director of Nursing, Dr. Nicole Welch, who plays a pivotal role in informing that panel. The panel is focused on giving us feedback on our 13-point collaborative strategy towards student and school safety. Secondly, we're happy to resume an intentional and strategic relationship with Toronto Public Health through the renewed Toronto Healthy School Strategy, which will guide our individual work as school board staff, as well as work in partnership with Toronto Public Health and other boards. And then lastly, we do share data through agreements and other informal mechanisms. We really benefit from the research and evidence brought forward by Toronto Public Health. Recently, Associate Medical Officer of Health, Dr. Chris, shared research on youth outcomes with our school leaders prior to school opening. It was insightful and important information for them to integrate into their local leadership and for us to really integrate into our work as a district school board. Dr. Dubé and Director Welch have regularly presented to our Board of Trustees. This represents a systems approach and really an integrated approach to the issues impacting children and youth health outcomes. And then lastly, I just want to affirm many of the points that were brought forward in the presentation. We continue to look closely at food insecurity and childhood nutrition, mental health, the transmission of infectious diseases, which also contributes to absences from school. And we know that absences from school decreases a child's chances of graduation. There are many other important health outcomes that we are working on together, and I'm grateful for the leadership and the partnership with Toronto Public Health. Thank you.
I will just jump in then on that with my colleague Colleen, and appreciate everything that she's shared so far and the partnership that we have together through this with our French colleagues as well. I think that when you are in times that are easy, partnership is easy. But when we're in difficult times, it really reveals the depth and the ways in which we're connected, and that was revealed through our work together throughout the pandemic. We were meeting weekly with members from Toronto Public Health, sharing data back and forth, really talking about strategies, and just the ability for us to pick up the phone and have these conversations very frankly and very quickly was so appreciated. And it really did contribute to our ability to pivot, our ability to provide access to resources, whether it be information, as Director Rollins said, Russell Rollins said, with our trustees and the public facing, or whether it was being able to provide access to clinics in our schools and be able to really get out into the community. It really does come from a relationship that is committed to the work and making sure our students and our schools are safe. I too am very interested in when the data that Director Welsh shared in this presentation, and echo that in the recognition that we all recognize the importance of students being in school, that importance of their connection with one another, the social aspect, the negative impacts of the pandemic we are feeling deeply in our schools, whether it is mental health and ways in which students are interacting with one another. We've just missed so much time. So the ways in which we are coming back together and being really thoughtful about the importance of being back in school, but also the importance of doing so safely, is a huge part of our work together. Echoing what Director Russell Rollins said, Director Welsh and Dr. Dubé almost feel like staff in Toronto Catholic School Board. They are regulars at our board meetings, at our principals meetings. They are at an upcoming board meeting for us. They will at an upcoming principals meeting for us. And while they're different conversations, and sometimes at the public level, it's about what we're working on together, how we can think publicly about staying safe. We're really practical at the school level, talking with our principals about best practices, working together, communication strategies, and that is ongoing. What we learned from the pandemic is the importance of that ongoing work, and that's what we're committed to moving forward. So we realize that there's a lot of work to do. We realize that there's a lot of interest in how the fall is going to play out and incidents of COVID and moving forward, as well as mental health. But we recognize that the importance of students being in school and us doing so safely is their ability to work together. So we're very appreciative of the work that we do together. We're appreciative of the way that we are connected with all 4 school boards in Toronto, with Toronto Public Health, and we look forward to doing this work moving forward in ways in which keep students' mental health, well-being, and student learning at the forefront while doing so safely. Thanks for the opportunity.
Thank you so much. Thank you, Director Welsh, Dr. Dubé, and of course, Director Russell Rollins and Director Brown. It's nice to see both of you again. Don't go away. I don't know if you're busy or not, but we do have 2 deputants that we need to hear from before we proceed and ask questions of you. So we have 2 speakers, deputants right now. Kate Dupuis, are you here? She's not online, no? Sam Kaufman? Okay, Mr. Kaufman's online. You do have 5 minutes. You may proceed when you're ready.
There, can you hear me?
Yes, we can hear you.
Thank you. I'm here to speak about some things left out of today's report on the pandemic's impact on children. The report discusses decreased mental health and well-being, physical inactivity, increased screen time, overdue immunizations, and missed dental screenings. While these impacts on kids are real and serious, they're all secondary and direct consequences of the pandemic. What's missing from this update is a discussion of the equally serious and ongoing direct harms of the ongoing pandemic, and I stress ongoing. Despite most people abandoning most precautions in 2022, COVID has never left, and it continues to circulate at high levels, wave after wave, and to cause ongoing damage. What do I mean by direct harms of the pandemic? Mostly the short-term and long-term effects of infection. We've started the 4th school year of in-person schooling in the pandemic. Does Toronto Public Health have any idea how many kids were infected with COVID last year? Do they know how many extra days of school were missed? Do they know how many kids have had their second, third, fourth, or fifth infections? Do they know how many cases of long COVID have resulted? A recent meta-study suggested that about 16% of infections in kids will result in long COVID, and that may mean sleep problems, disabling fatigue, or serious cognitive, mental health, and behavioral issues. For adults, even after multiple vaccinations, the long COVID rate is about 10% per infection, and risk accumulates over multiple infections. What about other long-term consequences like vascular disease, immune damage, extra cases of diabetes, and so on? These are all missing data points because nobody is looking for them. Here's another missing data point. Does TPH know how many secondary transmissions there were from students into their households? Some studies have estimated that 70% of household transmissions started with schools. The problem with these missing data points is twofold. First, without reporting or counting, it's easy to simply ignore these direct impacts, as today's report does. Second, it's then easy for the public to behave as if infection by COVID is no big deal and to do nothing to prevent it. If infection were important to avoid, public health would be warning people, wouldn't they? Isn't preventative health communication one of public health's most basic roles? Well, on Twitter at least, TPH's COVID communication strategy seems to be a disease-specific cone of silence. For other diseases, TPH engages in a rich variety of preventative messaging. Daily tweets this summer have stressed the importance of sunscreen, tick and mosquito bite prevention, mpox vaccination, drug overdose prevention, rabies awareness, Shigella prevention, bird flu control, hepatitis prevention, mental health, hydration, and avoiding heat stroke for humans and their pets, but not a single message on COVID. A Lunar New Year post in January seems to have been the last major message with any COVID preventative information, except for a booster reminder and 2 unusual posts in April regarding long COVID. What is it about this disease that has made TPH give up? It's not because we can't do anything. We can do a lot to prevent the spread of COVID. It's just very hard to do it if public health is behaving as if there's no problem. First, there's masking. Public Health Canada still advises masking in crowded indoor locations with questionable ventilation, such as schools. Is TPH aware of this recommendation? Second, there's ventilation. Is TPH aware of the recent engineering standard for control of infectious airborne diseases published by ASHRAE? This is a landmark standard which contains clear recommendations for schools, including solid numbers, and should really be applied everywhere. If they are aware, why has TPH been telling school boards as recently as 2 weeks ago that masking is a dubious optional intervention, less effective for a virus spread by aerosols than covering your cough and hand washing? Why did TPH say nothing about ventilation when asked directly by trustees except to defer to the Ministry of Education? Similar messaging was used in Friday's very late start of year email to parents and in fact just now, today. Is TPH being held hostage by the province? If so, can you blink 3 times to let us know? My son entering grade 5 has masked at school for 3 years. Do you know how hard it is for a 10-year-old to be the only kid wearing a mask in his class? He's talking more and more about peer pressure. What about his mental health, wanting to stay safe but being afraid that he'll be teased or not accepted? And what's the mental health impact on a kid of knowing that the adults and institutions around you are doing nothing to protect you as your friends get sicker than they ever have before each winter? What are the impacts of seeing your parents having to argue, nag, and beg friends, family, schools, teachers to take simple precautions like opening windows or moving outside to reduce the risk to everyone? Think of the strained relationships. And this is largely because TPH is not giving people clear, honest information about how serious the situation really is and what sensible precautions really are.
20 seconds.
Ontario's wastewater monitoring has shown rising COVID levels for a month now, and we've already seen surges in the US and the UK. Last year was not a success. Public health needs to do their part to make this school year better. Thanks.
Okay, thank you. Any questions for the deputant? Seeing none, thank you very much, Mr. Kaufman. Is the next deputant here, Dupuis? No, still not here? All righty then. So we'll go back to questions. Councillor Grava.
Thank you, Chair. I'm just going to start with the questions of staff. I hope they'll come back. Or maybe you can answer them from there. That's cool. Just Can you comment on or speak to the risks of what I think is one of the most concerning things in this report, which is such low rates for the routine immunizations typically seen among ages 4 to 6 and age 14? What's the population level impact of that?
Through the chair, thank you for the question. So there are likely two reasons why the rates are low. One is that the children have actually been vaccinated, but they haven't been prompted to report to public health, in which case they have the immunity and the protection, and so the population level impact is low. The second is that the children themselves have actually not been vaccinated, and we know that that likely is also going on because we know through COVID, many children could not get into their primary care provider. And now that years have gone by, may not have realized that they've missed those vaccinations. We know, actually having done some work to the Board of Health about a decade ago, looking at, well, if Toronto's vaccination rates even drop by, say, 10% for measles, it could result in outbreaks within the city. And we know the kind of city that we live in where these infections are, as we say, just a plane ride away, with the travel that goes on and people coming here, high levels of vaccination are absolutely required.
Mm-hmm. So you've mentioned, you talked about the barriers that children have been facing, accessing family doctors and other, the fixed Toronto Public Health clinics that have been offered in the past. What are the ongoing barriers that you're observing to vaccination for this particular population?
One way to consider what the barriers are is to think of a framework like vaccine confidence is one framework, in which case the WHO defines 3 C's. So it's confidence, complacency, and convenience. So the convenience refers to the pieces on access to vaccines, and we know that that's very real. It will include also parents having time to take their children to get vaccinated. That may also include children maybe not wanting to get vaccinated and addressing some of those concerns. Confidence refers to vaccine hesitancy, and we have heard of preliminary reports or anecdotes of people saying that they have vaccine fatigue, for example. Maybe they had questions about vaccines through COVID, and some of that may be spilling over into routine vaccines that had very, very high adoption before. And complacency, I think, is another real factor where people just haven't really realized that they need to get vaccinated. They may think that, well, they made it through COVID without getting the vaccines. Maybe it's not such of importance right now.
Thank you. So clearly from what you've been telling us and what we know historically, the opportunity to get vaccinated in school removes barriers when compared to 2022, 2023 rates. I just think that the ongoing barriers of going to the family doctor, et cetera, versus being in school, could additional in-school vaccination opportunities for ISPA required vaccine help to boost vaccine coverage among students?
Through the chair, it's a really good question. We did offer in-school vaccinations through COVID, for example, for COVID, and actually found that the uptake was not as high as one would expect. And some of the reasons for that was we found that children who were younger wanted their parents to be there. Parents want to be there when their younger children get vaccinated. There are also the issues of consent, where consent is required before a clinic. And we know through our routine process of providing vaccines in grade 7 and 8 that what we call the backpack express of sending those consent forms home and getting them brought back can sometimes be challenged as well. We also know that by providing vaccines at school clinics, if parents have questions about the vaccines, they can't get those answered because they are required to complete the consent form and bring them. And then finally, just to say that we do have 850 schools across the city. And so having the ability to have those clinics in schools can be challenging. We've heard from schools as well, too, that when you have a clinic, uses their gym or their library for that day, and that can sometimes be disruptive for them as well.
So it's a different strategy that's needed here, because clearly, even if we added, the unreported vaccinations, we're facing a bit of a crisis coming up. Because I'm sure you'd agree that there'd be a massive human cost if these kinds of diseases start spreading in the student population.
Yes, so if I may, Councillor, add a little bit to that which Dr. Dubé has already spoken to. No question, there is no more strong proponent of the importance of childhood immunization than those of us at Toronto Public Health. We recognize the value of vaccination and the protective benefit it provides, yes, to the children who are receiving the vaccines themselves, but to the entire community around them as well. So I think there's a real opportunity. As you saw, there are a number of different topic areas that are the kinds of areas of focus that we're working on with our school board partners and with the schools themselves and the communities of the families and the students that attend those schools. And certainly figuring out, knowing what we know, looking at all the lessons we've learned over the last 3 years and lessons learned before. What is the best way by which we can actually deploy the life-saving benefit and the health-promoting benefit of vaccines for the benefit of our children and for the benefit of our city as a whole?
Thank you.
Thank you. Any other questions? Director Zhao?
Great, thank you. So I just had a question about the fall rollout of the influenza and COVID vaccines. So particularly you mentioned like younger kids, they prefer parents there, but what about like older kids when you're giving the HPV vaccine, the hepatitis B vaccines? Will there be like a school-wide rollout of the flu and COVID vaccines?
Through the chair, influenza and COVID vaccines will be available at Toronto Public Health clinics, so those 4 clinics. There will also be mobile clinics across the city to be able to provide those vaccines. In our experience, the older children are quite mobile, and so as long as there's a vaccine clinic on the subway line, they will often come. Many of them can provide their own informed consent and can get vaccinated as well. When it comes to those fall vaccines, we actually also want families to be vaccinated, and so we have often found that it's families that come together to our clinics to get the vaccines as well. Also important to note that those vaccines will be available at pharmacies, over 500, I don't know what the exact count is right now, for flu and COVID. So they are also accessible at pharmacies and at primary care providers' offices when the vaccines will be available. They are not yet available.
Okay, and just to clarify, the COVID vaccine itself, even though there may be like a new strain, we're still using the bivalent one, right?
Through the chair, that's a great question, and we are actually expecting Health Canada to approve an updated vaccine, maybe as early as this week. It will be what's called a monovalent vaccine of the XBB strain, and so it will be an update to the current bivalent vaccine. And so once Health Canada approves that vaccine and it's available, that is the vaccine that we will be providing in the city.
And it will be available like this coming fall for?
It will be available this fall, yes. And so it's really a day by day, watch the news to see when it will be approved and when it will be available.
Okay, and my last question is just around mandatory vaccines. There are certain vaccines that on the Immunization Connect say are mandatory, such as meningococcal, but in your data, only 74% of students have it. What is the consequence if, let's say, a parent doesn't give consent or a student does not get a vaccination for whatever reason? What do the school board do about it?
Yeah, through the chair, the vaccines under the Immunization School Pupils Act are either a child is required to show proof of vaccination or have a valid exemption, and meningococcal is one of those vaccines. If a child is not up to date with their vaccines when we complete an assessment, they usually get 3 rounds of letters from Toronto Public Health, and then based on the Immunization School Pupils Act, a suspension order is given to the school, and the child can be suspended from school for not showing proof of vaccination or exemption.
Okay, thank you.
Thank you. Next, we have Deputy Mayor Malik, and then Councilor Thompson, and then Director Ozade. Go ahead.
Thank you very much. Thank you for the presentation and for the questions that my colleagues have asked. I guess I just want to begin by just turning attention to one of the items that jumped out to me in the report, which is the Ontario Student Drug Use and Health Survey that reports nearly half of Ontario students reported a moderate to serious level of psychological distress. And I'd just like to hear a little bit more about what is being done, both provincially and here at the city level, to address this issue, particularly for this, this school year.
Thank you for that question, and through the chair. Sorry. We do work collaboratively with the school board, so there's a variety of things that are happening through our work with the schools and also at the city level. So the area that we are working very closely with the schools on our mental health promotion and to bring in a healthy school community. So we look at a variety of aspects that we know will improve students' connection. And Dr. Brendan Brown, Director of Education at TCDSB, did mention that the importance of having that social connection. So the school liaison nurses will work very closely with social work and the mental health leads at the school boards to bring in different activities within the school to create a healthy environment. So we look at physical activity, which we know we increase physical activity, decrease screen time, that improves the mental health of students. We also work with the school, the teachers and the educators within that school community to develop their capacity so they can ensure that they're integrating good messaging around physical activity, nutrition. We know nutrition impacts students' mental health, and also working with student leaders within the school to support different activities that they can bring in. So some of the activities that some of the schools have initiated over the years was during exam times in secondary schools. They may start up a mentorship or support and have students, come forward and speak to either other student leaders or the school staff or the school liaison nurse to identify if they're having stress or concerns related to exam period, etc. So we do an integrated, comprehensive approach when we work with the school community. As far as Colleen did mention, Russell Rollins, Director of Education at TDSB, the work that the city's doing around school safety and well-being. So we do sit on the expert reference panel for school safety and student well-being, and we're looking at different interventions and supports and integrating our response with the work that SDF&A, Safe TO, is doing as well to reduce violence in schools. We also provide supports for parenting through some of our early childhood education so that parents are better equipped to prepare their children. So there is a lot of work, and it has to be looked at holistically and comprehensively to really help support students' well-being. We have a lot of work to do, and we continue to try to develop the system and support it and advocate for increased supports within the overall system. One of the areas of concern that has been identified is the long wait lists for students that do present with increased mental health situation or illness and need supports that are beyond what can be provided by the school. So there is School Mental Health Ontario, which is funded by the Ministry of Education, with the school boards do work within that framework. Tier 1 is mental health promotion, and that's where we do a lot of our collaborative work. Tier 2 is what the schools provide through their social work and special education supports to provide additional counseling. And then it goes on from there, where Tier 4 is referring to community providers to provide significant mental health interventions and treatments for students.
Okay, thank you for that. I mean, there's obviously you're working at a lot of different levels, But again, going to that piece around moderate to serious level of psychological distress is something that I think requires our attention. And picking up on what you said, the report also states that for serious mental health concerns and psychological stress, clinical services are needed. And I'd like to understand if these clinical services are both available and being accessed by our youth and what that looks like.
Final question.
So those clinical services, as I'm sure, and through the chairs, that you're aware, is not something that Toronto Public Health provides directly, the mental health intervention or treatment at that level. The school boards do have their social work teams, and there are mental health nurses that also provide support through the school boards. And then it's a referral to the community or the children's mental health treatment centers for that additional or more intensive interventions that are required at a clinical level. And they are seeing that there is still a significant wait list for children to access these services. And thus we have a recommendation, our second recommendation to the province to increase the supports that are given to children. So there could be a seamless movement between, tier 1 mental health promotion to community supports and clinical supports that are needed by students that are experiencing more distress.
Sorry, just to be clear, the services are available, they're just not run by Toronto Public Health? Or they're not available?
There are services available for clinical treatment and support for children. There is a long wait list for those services and supports.
Okay, thank you.
And yes, they're not provided by Toronto Public Health, not those clinical intensive interventions, no.
I just have one final question, and then my other questions have been asked, so thank you, everybody. The report mentions using the province's School Health Guideline 2018 as a complement to the city's work, and this is related to the immunization piece. I just want to hear a little bit more if this document still represents best practices following what we learned through the pandemic, or if an update is needed.
Through the chair, that guideline or update is the first time we saw it in the Ontario Public Health Standards, which mandates the work of public health units across Ontario, a specific school health guidance document that's included in there. Yes, it still covers a wide range of topic areas that would be of importance to improving the overall health of children. School-age children and youth. And I understand, and Dr. Davila will know more on this piece, that the province will continue to examine the Ontario Public Health Standards and make updates in the next few years, I guess. Yep, I'm just checking the timelines there, which would include any lessons learned throughout the pandemic. But the guidance or the standard that's in the document currently is still quite relevant and is evidence-based. One of the things in Toronto Public Health that we utilize as well is our youth engagement strategy. We use a best practice guidance document to support that work, which is evidence-based as well. So we continue to explore using those documents and keeping up to date on any new information that we learn over the next little while as we continue to monitor very closely with our school board partners the health of this population.
Okay, thank you. Councillor Thompson?
Thank you very much, Mr. Chair. Good morning, everyone, and thank you for the report and an excellent presentation. Can someone tell me what is the percentage of children and youth in the school system that are considered a special need?
So through the chair, looking at our staff here, we don't have that number available to us, Councillor, but we're certainly happy to report back to you on that.
Okay, fair enough. I mean, I'm aware that in Ontario, it's between 15 and 17%, and most have issues around development disability, physical disabilities, and communication delays, and chronic medical conditions and so on. So my question is, what actions are being taken through this report to address the impact of COVID-19 on special need children and youth in the system?
So I'm going to turn that over to my colleagues, but I do note, Councillor, that I believe our school board partners are still on the line. They may have a better sense as to the proportion of students within their respective populations that would be described as within the special needs categorization. And if I may, infection prevention and control, I think you're asking in respect of our special needs population at schools. Is that correct, Councillor?
Absolutely. Yes, absolutely.
So if I can turn it over to my colleagues.
Yes, thank you. And through the chair, I believe Director Russell Rollins had to leave to go to a prior commitment. And I'm not sure if Brendan is still on the line with us. But to answer your questions related to special needs children, it's as far as any intensive supports and therapies that they require, that's under the purview of the school boards, and through their special education and social work will be quite involved, and a variety of other providers within the school environment, such as occupational therapists, to provide that extensive support to those students. We do include all students in any of the work that we're doing around mental health promotion and other public health work, like such as physical activity, et cetera. We do take that into consideration, a very equitable approach, so that all students can participate in the activities that are available in the school environment. So it's something that we would definitely work with the school administration, teachers, community, to ensure that no kid is left behind. As far as infection prevention and control work, particular to this community or to the special needs population that you're asking about, we would continue to provide information and education to all students and families around, as Dr. Dubé presented, preventing respiratory illnesses, et cetera, in the school environment, doing vaccine confidence work, that would be available for all students. There is work that happened during the pandemic that you may be aware of in some of the schools that provide education to children that have significant needs, and we all partnered with Sick Kids Hospital, or Sick Kids Hospital took the lead on that, because that is very specialized care that is required and outside of the purview of public health. So they would continue those relationships and have those supports that needed. And I see that Dr. Brown is visible on screen, so I can turn it over to Dr. Brown. Thank you.
Sure. Through you, Mr. Chair, to Councillor Thompson. The numbers, the percentages you gave would be, fairly accurate. But you just have to keep in mind when you look at special needs writ large, it is not a homogenous group. You've got students with learning disabilities, you've got students with language impairments. I think when you're talking about students perhaps who have autism or students with complex needs, that we're talking about would be less of a percentage than that, because the special ed includes students who are gifted, includes students who have learning disabilities. So, and I would just also note that even for the info of the Board of Health, during some of the most challenging times during the pandemic, when the whole province was shut down, within our school boards, we still had our amazing teachers and support staff, educational assistants in our schools, providing that ongoing consistency and respite for families of our most complex students. And what we learned through that was just the importance of all of those preventative work that we do, because it's perhaps a little bit more of a hands-on work in those situations with some of our most students with our most complex needs. And a lot of those strategies that were put in place during the height of the pandemic remain as good practices that we have moving forward as well. So we're proud of the work that our staff do to continue to keep students safe in our school. We learned a lot through the pandemic, but the numbers we're talking about when it comes to our most complex needs would be a little bit lower than that percentage that you would describe. So hopefully that's
well. Thank you very much for the answer, Mr. Chair. Just through you, I can tell you that the number of calls I'm getting from parents with respect to concerns or the impact of COVID on their children with special needs have increased tremendously, and that's part of the rationale of asking the question. Mr. Chair, it's taken a long time for me to get the answer. I just wanted to know if I can just ask one follow-up question to
Yes,
this.
go ahead,
And
Councillor Thompson.
thank you very much. And I realized during the pandemic, again, special needs children obviously had challenges because they were not able to go to school, and through the process of obviously learning and going to school and maybe getting a nutritional meal because of the programs that are available and so on. So because of the pandemic, obviously they lack the ability to do that. And we've seen, at least in my area, we've seen a situation where a number of children we've seen the increase in diabetes and also just issues around cholesterol level, as well as other medical conditions. Now, this comes through conversation I've had with varying number of parents and so on. And I guess my question then through you, Mr. Chair, I guess to Dr. Davila and team, what actions are being taken, if any, that would help to provide special screening that would be introduced to this category of children and youth that may need this to be able to identify those who are at risk, not getting proper nutrition and so on? Thank you.
So through the chair, we'll probably combo answer this. I'll start off though. So as part of the process that my colleague Nicole Welch spoke to, you heard that healthy nutrition or good nutrition is certainly an area of focus that we've agreed upon with our school board partners and our schools. And so this is an area that is being worked on as part of our Healthy Schools strategy. And to be clear, during the pandemic, you were quite right. There were challenges. There are meal programs that are associated with schools. But we did work around that, making sure that there was access to healthy food for those families who were at highest risk and needed those services available to them through gift cards and other programs that helped to enhance food security. But with respect to specific programs, we know that the schools are being assessed. We have a Healthy Schools team. They actually do the work to assess some of the issues that exist within different school communities and then work collaboratively if healthy nutrition or better healthy eating is one area identified. There's opportunities for our staff to engage with that school on specific programming and services and interventions that actually support better nutrition. Nicole, I'll let you speak to the rest.
Thank you. And through the chair, just to add to that, that's exactly right. And we are working with the multidisciplinary team at Toronto Public Health, where we have dietitians, our school liaison nurses, who are our public health nurses, as well as nutrition promotion consultants. And we're in the process of ensuring that our information is updated to meet the needs of the school community. So we are looking at the current data and concerns that parents are raising now, and in collaboration with particular school communities, the school liaison nurse and the other members of our team will work very closely to provide information to families on healthy eating, as well as supporting participation in student nutrition programs if available at the school, and also doing some capacity building with the teachers and educators in those particular school communities.
Thank you. Next up is the Director Ozude.
Thank you so much for the report. And I remember a couple months ago after the health check report, TO health check report was released, I actually left that meeting feeling a little depressed about the state of, the future state of health of Toronto. And I find myself in a similar state right now because it seems that none of the indicators that's been reported here is trending in a good way. So physical activity, drug use, etc. So I'm just curious, is there any promising indicator at all about the health of children and youth that is trending in a good way?
Director Welch, you spoke to that in your presentation. Yep. So, and if Dr. Brandon wants to speak about it as well, go ahead.
Okay. So through the chair, and thank you for that great question. So I think we have to keep in mind that we're looking at this data, tracking it over time. We're working in collaboration, and there's a strong commitment from all the partners at the table to look at improving the health of young children and youth, and really collaborating to make a difference in their lives. There are some data that was reported that had not been as bad as we anticipated, and that's particularly in the substance use area. So if you do look at the data, you'll see it's been stable. So pre-pandemic rates and post-pandemic, we have not seen huge changes other than vaping and the nicotine piece. So there is a lot of concerted effort that we are working with the schools in ensuring that they have the proper information. We work with our smoking bylaw officers as well, because vaping in school property is not permitted. It's against the law. So ensuring that the school administrators have the resources and information that they require. So in tracking this data and working collaboratively with the school boards to share data between or amongst us, we can track it closely and continue to do some concentrated work. The mental health of, well, I think, the population is experiencing, the post-pandemic impacts, and there are issues there that we will definitely continue to work on. As mentioned by Colleen and Brendan, some of the work around school safety and student well-being is very important work. And when we talk about school safety or violence in schools, we have to go to those root causes of what those violence are. So the conversation at the expert reference table does talk about, anti-racism, anti-oppression, and implementing the strategies that are so important to improve the overall health of students. We know that if we can keep students healthy so that they're able to learn and engage in the school environment and have that social connection, overall that improves their health. And the evidence has showed it reduces violence as well. So we continue to focus in on that work. I think we're seeing an uptake in the student immunization program, and parents quite interested in getting their kids immunized, getting their kids the dental screening as well. So we will continue to work very closely and promote that, and with the help of all of you as well, to move this forward and to show our commitment to improve the health of this next generation. Thank you.
Okay, thank you for that. And my other question is, so it seems that public health is still catching up with pre-pandemic immunization levels. So what is the spread right now across schools in the city? So are there more schools that are more affected or that are lagging behind more than others?
Through the chair, that is an excellent question and something that we actually have been discussing at Toronto Public Health and are looking to analyze the data by school, by neighborhoods, to see if we do have differences across the city.
Okay, so we don't have it yet? We don't have the data yet, you said?
Right now, we don't have it broken down across the city. We just have the overall rates, yep.
Is it possible to put in a request that when it's ready, present it to the board?
Through the chair, we would be pleased to present that data to the Board of Health.
All right, thank you.
Thank you, Director. Next up is Trustee Sriskandarajah.
Hi, everyone. Thank you, Director Walsh. And it's nice to meet you, Dr. DeVay in person. You were so instrumental, and I know Councillor Moyes, I'm sure, shares the sentiment. During COVID, we had our weekly meetings, and there were a lot of meetings, and there were a lot of questions, tough questions, and you did a fabulous job, so I'm very happy to have this opportunity to just state that here. Wonderful colleagues' questions. I think Charles just asked the questions about space, so I won't reiterate that. I just have one question. You mentioned that public health, the reporting to public health just might not, parents might just not have gotten to do that. Could you explain a little bit about that? So is it the sense that the province, like the doctors, I assume they inform the province because they would have the database, right? Family doctors? No? Okay. And what's the coordination? They don't tell us. How can we streamline this? Because it seems like we might be duplicating a lot of work that probably shouldn't be happening.
Through the chair, that is an exact sentiment that we have as well too, that it is actually very frustrating for parents and physicians alike, for public health as well too, because we do not have a registry for immunizations in Ontario, and just want to flag that that was one of the recommendations that the board had made to the province in the previous report in 2022. On a registry. So the ideal system would be the physician gives the vaccine in the office, it is recorded into a system that is then accessible by public health. Now, we had that through COVID, it was called COVAX. That's the only vaccine that currently has that type of system. So what happens right now is the vaccines are given primarily through primary care. The parent will have usually a physical yellow card that they will carry around and should keep as safe as they do their child's passport. But the parents often will assume that the physician has reported the vaccination to public health, but that is not the case. The physicians don't have the duty to report. They also don't have the mechanism to report that very easily to public health. And so it falls on the parent to report it to public health. We now have an online tool that we've had for a few years where parents can do that. It is a very manual process to submit that data to us, however.
Okay, thank you. That's good to know. I will look for that little yellow passport because I didn't realize how important it was. Because as you mentioned, I think there's an assumption made on my behalf. So maybe that's a public education campaign we need to tell, because I didn't, I wasn't informed. So do we know what the vaccine registry hesitation is from our provincial counterparts? Why it seems like common sense?
Yeah, through the chair, as long as I've been in public health, which is a long time, this has been a recommendation even at the national level. What we have heard is that the technological systems to have in place, the legal and privacy considerations, and for it to be able to speak to so many different providers have often been the stumbling block. Always are hopeful and have heard that the province is undertaking a review of many of their technological solutions, so to speak, and are hopeful that a registry may be a part of that discussion in the future.
Okay, and finally, because as you mentioned with COVAX, I assume the infrastructure is in place now, at least for that vaccine. Is there any renewed appetite perhaps for, and I know you might not be able to answer this question, because now the infrastructure has been built, they have the capacity, we see they have the capacity and gotten over the legal privacy issues. Do we know, or is there any plans for a renewed ask since there's sort of a different environment now?
Through the chair, COVAX was excellent in being able to receive the data. What we did hear from providers was it was very clunky. It actually took a lot of resources to use. Many physicians don't have access to COVAX, which is why they didn't provide COVID vaccines. So, and COVAX was not expanded to include flu vaccines, for example. So COVAX was a good solution at the time, but it's not a good long-term solution, as we have heard from the province and from frankly, our providers as well. So I think it does have to be a more comprehensive solution that can work into the future.
So if I can add to that, through the chair, I think you're quite right, though. You're bringing up the notion of the value of an immunization registry. And certainly that's been something we've been espousing for quite some time and will continue to do so, because we've had the opportunity to see the benefit of it in the context of the COVID response. And certainly even before there was such a thing as a COVID, we recognized that there was real value in having a true immunization registry, not just for the city, not just for the province, but for the entire country, in fact.
Thank you, that was really informative. Appreciate that.
Thank you. Deputy Mayor Morley.
Thank you, Mr. Chair, and to my colleagues, great questions. I just had a couple little ones, big ones. With respect to the school liaison nursing and nurses that are available, what's the percentage of coverage that we have of nurses in our schools right now? Is there a nurse in every school? How does that work? Is a nurse assigned to a few different schools?
Thank you, and through the chair. So currently, the model that we're using is schools have access to a school liaison nurse. There's a universal coverage, and they will have access to a variety of the different programming and information. We are using the school board's criteria to identify schools with increased need, to have nurses that are assigned to those schools with increased need, having a smaller caseload or smaller number of schools so that they can be present at the school community, physically present in the school as well, and working closer with that school community. So it's not a one-to-one ratio. There's about just over 800 publicly funded schools in Toronto. So, and we have just under, I can't remember the exact number right now because it's fluctuating as changes are being made with staffing, but we do have around 60 to 70 school liaison nurses. And we do work with other public health staff as well that will provide support. So we have sexual health promoters, dietitians, et cetera. So we do have a multidisciplinary team that can respond. So we are really going to focus in on those schools of highest need as defined by the school boards to ensure that we're taking an equitable approach in providing the services that they require.
Very helpful, thank you. I wanted to just echo my colleagues' sort of thoughts and suggestions around this idea about whether we need to do more of a public health, public education campaign around registration for these immunizations in the short term, because it is one of the biggest takeaways for me certainly was the current status of immunization and the steep decline. Based on our pre-pandemic numbers. So I just wondered from staff, what do you think the best sort of short-term actions are that we can be taking to see some improvements in this area?
Through the chair, we have had some public campaigns in the spring and also some planned for the fall to get this message out to parents. We recognize that the message has to be given to parents at a time when they can hear it and act on it. So what we do find that also works very well is sending reminder letters to parents where they get it individual for their child. We know that that prompts action as well.
Got it. Thank you. I just had another question, and this one specifically to COVID-19 and the vaccines related to COVID. I have the great pleasure of coordinating and also having regular meetings with Dr. Dubé to share information with our community around the vaccine engagement efforts in South and Central Etobicoke when we were still in the acute phase of the pandemic. And I recall how informative and helpful those sessions were in terms of combating mis and disinformation. And so I just wonder what you can share in terms of your own experience around mis and disinformation in communities that continues to spread. I think really, on social media, folks are isolated, really taking a lot of screen time, and there's a lot of misinformation online. And frankly, the changing nature, like how new things are, can make folks hesitant. So I just wanted to get your take, some of your feedback with respect to how we can continue to really focus on providing the facts to folks as a means to get them to do, to get in and get their immunization as needed.
Through the chair, thank you for the question. We certainly know that misinformation, disinformation is a very real public health concern related to vaccines and other topics. One of our interventions in public health is about providing information, providing supports to encourage action. So that is something that we will continue to do ongoing. What we did learn through the pandemic, it's more than just about, having information on our website, but being able to increase trust, for example, having peer support or colleagues or friends or family referrals. We know that the referral from a healthcare provider or message from a healthcare provider really helps to enhance public health messaging. So we continue to work with partners to be able to address misinformation ongoing, to build trust. That will be part of our ongoing work in public health.
Great, and if I mean, just really quickly, thank you, Mr. Chair, for we're all very obviously engaged on this. I think Mr. Kaufman brought up a couple of important points around data sets and sort of what we're looking at and what we need to be continuing to keep in mind. And I appreciate, again, through my experience, we do look a lot to the Ministry of Health and to the province to sort of guide what information is being released publicly and sort of how we're navigating, right? Working in coordination with them. And I just wondered if you could speak a little bit to how our response and how the information that we're able to make available has maybe shifted or changed based on the direction and or leadership from the province.
So through the chair, why don't I take a stab at answering that. I think some of the challenges are, of course, that testing has changed completely within the context of the province. And so I remember that there were some points raised by the deputant in respect of numbers, repeat infections, and the like. And in fact, what we're finding is that testing is not as available, and people aren't using testing methodologies, and even if they are testing, there isn't a mechanism by which to report. So certainly trying to understand numbers at that level is challenging at best. That being said, we do have other mechanisms, and you'll note as we updated this board some time ago, I can't remember the exact date, but we have provided you with updates in respect of what information is available and are continuing to provide that information to the board and the public. We still continue to maintain reporting in respect of such things as the case counts as we have them. Certainly the healthcare system is keeping an eye on hospitalizations and ICU admissions. We are watching things like wastewater surveillance continues to be a tool that's available to us. And these are the kinds of data that are more readily available to us at this point in time. But again, as you heard through the presentation, and as you'll continue to hear throughout the fall, there are a number of lessons learned over the course of the pandemic, protective measures that we can all adopt, and these are especially important for those who are at highest risk of negative outcomes and serious outcomes associated with COVID infection.
Very helpful, thank you.
Yeah, thank you. One of the few positives of being chair is that I'm the last person to actually ask questions, and most of my questions have been answered. But I do have one question, though. Director Walsh, in your presentation, you mentioned that there's been many increases in various areas, cannabis use among young people, alcohol use, more screen time, less exercise. It seems like a perfect storm. And, I was a trustee during the pandemic, and, some of these behaviors I'm going to classify as social abnormalities. I just coined it right now as we speak. And I think it's a result of the pandemic. And it's manifested itself, these behaviors have manifested themselves in many ways. And I've seen it, at the school board through violence in the schools, sexual assaults, you name it, all the things that, we don't like to see in a school has happened during the pandemic. And, it came to a head, I believe, just last year before school ended in June, and where the city actually got involved and, various departments got involved working with the school board to address some of the violence that we've seen. So, and my concern is that now that school has started again in September, that, that may just amplify or continue. So my question, in a roundabout way, what recommendations or suggestions do you have that, the Board of Health can actually partner with and help the school board with in dealing with some of these issues? You may not have an answer, but I'm just throwing it out there.
So through you, Chair, that's a large question. And I think I would start with particularly around the issue of violence. So you heard today from Director Russell Rollins, the work that is happening with the city and that we are involved in as well. Toronto Public Health participates with this overall planning and the comprehensive response. As I mentioned before, we really need a holistic approach, and it's not one solution that's going to fit all situations to reduce this. Some of the evidence that we've seen in this report where children are, not participating in physical activity as much, which we saw change throughout the pandemic, increased screen time. These are things that we are working very closely with the school board to tackle. We know that kids, when they are more physically active, have more outdoor time, have less screen time, are connecting with one another, person to person. Nutrition, ensuring that children have healthy nutrition. All these things contribute to healthier mindset for kids, better mental health, better overall physical health. We know the evidence shows that that will reduce the outbursts or I believe you called it antisocial behavior. So it's very important that we continue to do that work. In addition to doing that work, we have to look at the root causes, which the city and the school boards, in partnership with Toronto Community Housing, Toronto Police through the Safe TO work, are looking at the root causes as well. So to ensure that there's anti-racism, anti-oppression, we know that communities that continue to experience this have higher rates of depression, which leads to a variety of issues. And we need to tackle that and ensure that our young people feel included in all aspects of our system, including our school system, so that it continues to be a welcoming, supportive, environment that's conducive to their learning and improving their overall health. So there's other things that we look at as well, but I would sum it up into that. And for the board to continue to support our work, very important work in this area, and to continue to support the strong collaboration with the school boards, which I know you're quite familiar with, being a trustee with the TDSB. In the past. So we continue to do that very strong collaboration and hope that we will continue to get your support in this area.
Absolutely. Is Director Brown still on the line?
Sorry. Unfortunately, he had to leave as well.
Okay,
Yeah.
fair enough. Thank you, and those are my questions. Before we go to speakers, I was told that Kate Dupuis is back on the line. Is she still here? I'll allow her to depute at this time. Ms. Dupuis, are you there? You may proceed.
Hi there, yes.
When you're ready, you have 5 minutes.
Thank
Go
you
ahead.
very much. Thank you so much for having me. I really do apologize for missing my original time slot. As a working parent of 2 young children who attend public school here in Toronto, I'm very happy to come and speak to you today. I'm grateful for this chance to address the ongoing COVID-19 pandemic and its continued impact on children and families right across our city. There are a number of ways that I believe Toronto Public Health and Toronto City Council can work together with schools across Toronto to help. And just having listened to your conversation, I believe that making schools safer, making sure kids aren't getting as sick at school, making sure education workers aren't off sick can also have positive benefits for mental health. We know that children thrive on consistency. Being away from school not only means children are missing out on the opportunity to connect with those healthcare professionals who are providing them with mental health care within their schools. Being off sick can also lead to stress and anxiety because children struggle to catch up on missed work, catch up on those missed crucial social interactions with peers at recess and the playground. In addition, we know that when teachers and other school staff are off sick and there are numerous different substitutes coming in and out of the classroom, this can be very unsettling for children and can have a dramatically negative effect on their learning trajectory. Given how disjointed learning has been for Toronto children over the last 4 years, it's imperative that we do everything we can to make schools as safe, caring, and supportive as possible to help ensure that all children across our city are able to learn and thrive. As I'm sure you all know, especially those of you on the call who are working parents, last year was a nightmare for many families right across Toronto with so many children consistently and constantly out sick with that triple-demic of COVID-19, RSV, and influenza. And then, of course, children invariably spreading sickness within their homes to their grown-ups. As a working parent myself, I know how challenging it is to try and juggle your own work and caring for your children. You're up late in the night, worried, trying to find meds for your kids, and also trying to care for your own health and well-being. We are already hearing warnings of a similar triple-demic this year. It's only September. We have a chance now in early fall to act proactively to try and prepare school boards across Toronto to deal with a difficult potentially difficult respiratory virus season. I saw that Toronto Public Health sent out back to school information last week. I'm happy you are reminding families to keep children home if they're sick, wear a well-fitting mask. You also mentioned ventilation. As we all know, after being through 3+ years of this pandemic, testing, access to PPE, and improving indoor air quality are all key pieces to the puzzle of keeping kids safe and healthy in their schools. So I have a few requests of you today. I'm not sure how much of this is within your control, but at least we have the chance here to have this conversation and hopefully to move things forward within our city. I wonder if you would consider, as Toronto Public Health, explaining to parents and families and educators and staff at schools exactly what you mean by well-fitting, high-quality mask. There could be a widespread public education campaign geared at schools and families. You could consider potentially using the terms respirator, N95, KN95. Provide visual examples of what this can look like to families, countering that mis and disinformation about the use of masking. Whenever someone says to me, oh, I don't think masking works, I always tell them, well, I lay in bed with my child who is sick and feverish with COVID in a mask, and I never got COVID-19. We need Toronto Public Health to explain to families exactly what we mean when we're talking about masks. Earlier, I heard someone mention reminder letters. We can't just have that letter that went out last week. Consistent reminders to families about how they can help keep themselves safe may help to combat misinformation. The letter that was sent out last week also mentioned the importance of masking when in crowded indoor settings with poor ventilation. As I'm sure you know, schools and classrooms are often crowded indoor settings. We don't actually know what ventilation is like in Toronto public schools. We know that clean air is key, not only in light of viruses such as COVID-19, influenza, and RSV, but also for those very smoky days like we had in June when children were forced to stay indoors with windows closed. It was so hot and stuffy in schools. It's very difficult to attend, to focus, and to learn with poor air quality. We even know from extensive research the importance of clean air on cognitive function. I hope that Toronto Public Health would consider working with Toronto Public Library, who has air quality monitors to lend, to create a Check Your Air program for Toronto Public Schools, where staff and students can work together with our libraries and our incredible librarians to help us find out more about ventilations in their school. And of course, this is consistent with the Board of Health's request that the Medical Officer of Health continue to work with Toronto school boards to monitor data. Finally, as we heard earlier from Dr. Davila, testing has changed in Ontario. We need to make sure that when people are sick, they have the ability to find out whether what they're sick with is COVID-19. The majority of Torontonians no longer have access to PCR testing, but we do have potential to access rapid testing. The Ontario Minister of Health has said that public health units across Ontario can access rapid testing. We need to make sure this happens here through Toronto Public Health. Thank you again for the time to speak today.
Thank you for attending. Any questions for the deputant? Seeing none. Thank you so much, Kate, for coming in today.
Thank you for your time.
Thank you. We'll move to speakers. Any speakers? Deputy Mayor Morley, go ahead.
Thank you, Mr. Chair, and I just, as always, want to thank staff, Director Welsh and Dr. Dubé, Dr. Davila, of course, for your incredible leadership. We, as we know and we've said, all along, we are not through this pandemic, and this is going to continue to take the best of all of our efforts, including continued collaboration. But I thank you for the report before us today. I'm especially encouraged and glad to see the call to action from the provincial government around some of the tangible resources that we know our students critically need right now. My colleague, Deputy Mayor Malik, highlighted the challenges that we're seeing with the psychological impacts for youth of the isolation and all of the various challenges that we've all experienced through COVID. And we need our provincial partners to ensure that there is not a wait list, but consistent, accessible care for these young folks who are navigating really difficult times. So thank you for that. A few other points that I just wanted to really highlight and encourage continued thought and leadership around is the collaborative tables. I know that was something that came really as a requirement through COVID, is having to break down a lot of the silos that we typically work in and finding opportunities to work really closely together with all various partners rowing in the right direction or rowing in the same direction. And so I'm encouraged to hear that that is an ongoing effort, and I think that that is going to be something we should be focused on for the long term. I also just sort of, as Kate was talking and making some suggestions around how can we improve our communication out to the public, an idea that occurred to me was something like signage in front of public schools, for example, with information for parents, for students, working more directly with the Ministry of Education on how are we educating young people about vaccination, the importance of it, how it keeps our community safe, as well as the parents. But I think we need to meet students where they're at. In my experience as a youth worker and a health promoter, that's always been the key to success, is meeting folks where they are at to begin with. And then the last thing I would just offer as a suggestion, because I know how incredibly powerful and transformative it can be, is really focusing on our young people, our young leaders, empowering them and building their capacity, because they know what they're going through. They know best what they and their peers are dealing with, and encouraging, supporting, and providing resources for them to hold space, to provide leadership, to come up with ideas for what they need, and then looking to us to help, fill in those gaps, I think is really a potent recipe for success here. And again, just want to share my thanks to all the staff, and we look forward to supporting this ongoing important work.
Thank you, Deputy Mayor. Director Ozade, you were going like this? No? Okay. Just waving at me? Okay, that's awesome. Okay, seeing no other speakers, I will put myself on the list. I do have a motion. Thank you. So we've spoken about a lot of these items here today. There's three motions. The first one really is to address the backlog in mental health and psychoeducational assessments over the pandemic. And so I've actually been working with our 4 school boards to talk about this. And so I wanted all of us to talk with one voice to address this very important issue. And I know that at this TDSB, I think it was last week, a similar motion was passed. So thank you to our colleagues there. So again, I bring this here again, when we pass it, if we pass it here at the Board of Health, we all can speak with one voice to address this very important issue. The second piece, I won't take credit for it, that's from Councilor Bravo and her team. It's really addressing the backlog in the ISBA required vaccination. Again, she can speak to that if you don't mind. It's your piece, but it's important. And lastly, Trustee Tristan-Roger alluded to this to a question to Director Walsh earlier. It's really around the vaccination card. I know when I was in school, we had a yellow card that we filled out, and I think I still have one somewhere. And things haven't changed since then. And so I know that in 2022, the Board of Health passed a similar motion asking that we have an online system that is more comprehensive and more accurate for everybody to use. So we're just bringing it back here again, asking the province to please go ahead and implement this this very important tool. So those are the 3 items that I brought forth, and Councilor Bravo can speak to the second item.
Thank you, Mr. Chair. It was a privilege to work with you and with staff on particularly the second part of the motion. I think that when we looked at the history that was provided of Toronto Public Health, the importance of ensuring vaccination, that those required vaccinations, is one of the most important things that we can do to prevent harm, to see much better population level outcomes, and to protect what is essentially and inherently a very vulnerable population, which, as you've heard from the deputants, there's so much concern about the conditions in classrooms today, overcrowding, lack of ventilation. I can testify that one of my children sat in a classroom for many months with waiting for window replacements, with plywood covering the windows, freezing in the winter, and boiling in the summer. So the conditions, the capital conditions in our schools are really problematic, and it's not allowing for the kind of spacing or the ventilation that's required to keep kids safe from the COVID perspective. But when we look at all of these other diseases that can be life-threatening, and I come from the global south, I've seen the impacts of what it looks like when people grow up having had polio. And I think that we need to really double down in every possible way to make sure that we're not creating today a firestorm that we cannot handle in the future. Clearly, this is a challenge that requires provincial support. Clearly, this is a challenge that Toronto Public Health cannot face alone. But innovative strategies, many of them have been mentioned here, require resources, and we need them. So on that point, I'm very happy to see this coming forward. I think there's also the many questions, and in the report, the implications around mental health of youth and children for Toronto Public Health as we move forward with the development of a mental health strategy. Which I think is really crucial so that we can provide the kind of advocacy with the voice that Toronto Public Health has, with the power that the medical officer of health has to speak to the issues of public health in this province. And I would hope joining with other medical officers of health and other public health units, because the mental health crisis facing children and youth is really crucial. And again, that's something that requires provincial action. I note that the provincial government has a $22 billion surplus, and I think everything that we're seeing today indicates that there is a required investment in schools. There's a required investment in mental health services, and in every aspect of what's going to help to ensure that this generation grows up safely and actually recovers from the 2 years that have been so damaging to their development. And the third thing, I think that we really hear today, the absolute imperative that children and youth be at the core of any strategic planning that's going on right now, going forward. Public health is all about the precautionary principle, and I think that the best precaution that we can take is to support the people that are going to be, that are growing up right now and that are going to be facing a lot of challenges in the future without our support and advocacy.
Thank you. Any other speakers? Seeing none, sorry, go ahead, Trustee Srishkunaraja.
Brief, thank you. No, I just wanted to thank all the movers for the great motions. And I want to thank Councillor Moyes for the motion. We did also pass one that I was happy to move at the Toronto District School Board. I think, when the Premier this weekend asks, what do school boards do? This is what we do. We hold the provincial government to account. So I just wanted to share that. And yes, to the yellow passports, nothing has changed since we were children. So I think it's time for some changes. Thank you.
Thank you for that. So all those in favor of the motion? Thank you. Adopted? Item as amended? Those in favor? All those opposed? Carried. Thank you. One down, two more to go. The next item is item HL 6.2, Toronto Public Health Backgrounder for 2024 budget preparation. I'll have Dr.
I can introduce her if you'd like.
Yeah, go ahead and introduce her.
So thank you, Mr. Chair, and thank you again to the members of the board for your patience. We're now on the next item, which is in fact a backgrounder in respect of our 2024 budget preparations, and we're joined for this presentation by our colleague Althea Hutchinson, who is online and on screen right now.
Good morning, everybody. I'm just making sure I can be heard.
Yes, you're good.
Okay, so thank you for this opportunity to provide to the Board of Health an update in terms of our budget 2024 budget preparations. So as you might be aware, we did have a Board of Health budget meeting on July 25th, and I made a presentation that's included in the package. However, since that time, our circumstances have changed. There have been some announcements made by the province, and I thought it would be fitting to come and give the board an update in terms of what our budget situation looks like for 2024. Next slide, please. So I'll be, as I indicated, providing you with an update in terms of what announcements from the ministry. I'll also be doing an update to our risk profile, which I think was one of our more telling slides in July. I'll also be providing you with an update in terms of the City of Toronto's 2024 budget process. And as requested at the July 25th Board of Health Budget Committee meeting, I will be providing you with just a quick overview of our intentions for our 2024 budget in terms of our capital operating as well as the service plans at this time. Next slide, please. So on August 22nd, the province did make an announcement. It was titled Ontario Investing in Stronger Public Health Sector, and it had 4 salient points in there that are outlined here. The very first one, of course, is that the province made the announcement that they would be restoring $47 million in funding to all public health units effective January 1st, 2024. And in essence, the way they characterized it was a return or a restoration to the 75-25% funding model. They also announced that there would be a 1% increase in funding for the next 3 years. Those years are, I put an asterisk there because the years are aligned to the province's fiscal year, which starts in April and ends in March. The other announcement they made, and this is a direct quote from the press release, they were going to work with partners to refine and clarify the role of local public health to reduce overlap to services and focus resources on improving people's access to programs and services close to home. And finally, they, in terms of the official announcement, they also indicated that they would be providing one-time funding resource to support any public health agencies that actually wanted to do voluntary mergers. Next slide, please. So what does that mean for Toronto Public Health? For us, of that $47 million, we actually have $14.6 million of funding that's going to be restored to us effective January 1st, 2024. And in terms of the 1% increase on an annual basis, you'll see here I've provided you with some numbers for 2023-2024, which is the provincial fiscal year. That has been confirmed to us that this will be the funding that will be flowing our way. And then for the next 2 years, 24-25 and 25-26, we've done some estimates internally to indicate what the potential will be in terms of the 1% increase. Next slide, please. In addition to the announcement, we actually did receive our 2023 accountability agreement. We got that in our hands near the end of August. And in that, as previously mentioned, the 1% increase for the 2023-24 provincial year was confirmed. We continue to have, in 2023, we still have the confirmation in terms of the continuance of the $14.6 million of cost-sharing mitigation. We also did receive some additional funding in the tune of around $20,000 for one-time funding for a new purpose-built vaccination fridge. And we also received confirmation for some additional capital in relation to the Ontario Seniors Dental Care Program. We received $590,000 for a clinic in Scarborough at 160 Borough Drive. And we had requested some carryover from existing funding that had been received that we were unable to spend to support 7 of our dental clinics. So the province did grant us the opportunity to retain that funding and to spend it in the coming year. Next slide, please. So at the Board of Health Budget Committee, I had presented a slide that really talked about our risk profile. And I was using the 2023 operating budget because at that point in time, that's the budget that we knew we had the most clarity on. And what I wanted to highlight here is that the announcements that were made for the province has changed our profile. And for the very first item there, that's the Ontario Public Health Standards cost shared programs. So our risk has moved from being mid to high to actually low. In addition to that announcement, we also did get confirmation from SSHA, so that's a division with the City of Toronto that is supporting harm reduction services within the shelter system. So we got confirmation from them as well that we will be getting funding in the next fiscal year for 2024. So we've changed the risk profile from high to medium. The reason why it stays at medium is because, of course, the funding does come on a yearly basis. If you would turn to the next slide, please. So what you'll notice is that this is the chart. This chart here really does highlight for us the significant change that has actually happened in terms of our risk profile. We had a chart that had a lot of cautionary tales in either reds, yellows, or oranges, and now we have a larger section that's actually in the green. And of course, that is just the representation of the province's announcement from August 22nd. Next slide, please. I also wanted to provide, at the time when we went to the Board of Health Budget Committee, we didn't have clarity in terms of how the city's 2024 budget process would unfold, but we did last week, or maybe it was a week ago, actually receive a letter from the city indicating what the 2024 budget process would be. The preliminary budget that we're going to be providing is going to be due to the city on September the 15th. In the instructions that we received from the City of Toronto, there are a few items I wanted to just highlight for the board for our consideration as we come forward with additional discussions about the 2024 budget. There was an expectation that service levels or services would be preserved to 2023 levels. For us, we're actually looking at preserving the service levels or ensuring that the programs that were in operation in 2020 pre-pandemic are the ones that we're actually targeting, given we were still in a very disruptive state in 2023. The other item that we got is that the city asked us to, put efforts towards eliminating or reducing any 2024 incremental budget pressures that we were bringing forward. They also noted that the COVID-19 impact should be accommodated within the 2024 budget. You'll notice I did asterisk that one, and only because our situation at Toronto Public Health is slightly different from that of other divisions, where other divisions, they weren't necessarily responding to COVID-19 as a pandemic or a global pandemic. We were, and so we continue to be in discussions with the ministry about what the response in terms of, COVID-19 will be moving forward in 2024, and those discussions will inform what budget is being brought forward into 2024 for us. The other item that the city did indicate is that they're asking that no new or services or service levels, with the exceptions of anything that was explicitly approved by City Council or has City Council's direction. And that's for the operating budget. For the capital budget, they had two asks, which I've rolled into here, and it's basically just to consider the readiness to proceed in terms of a capital project, as well as your capacity to spend. Are you actually able to spend the funding or the budget that you get for capital? Next one, please. So what I wanted to highlight here for the full board is that we have been working within the finance area to put together a submission for the capital budget. I will note that we will be coming back to the Board of Health Budget Committee in October with a more fulsome report that provides more details, as well as takes into any kind of into consideration, for example, the motion that was made on the previous item about including an item in there dealing with the ISPA vaccinations. But in terms of our capital budget, we've got a few projects that we're bringing forward. There are 3 IT projects, and then there are a few dental projects. So I've just provided for the board some information in terms of what is the IT project, the project description, as well as the budget that we'll be asking in 2024 and the future cash flows for those items. Next slide, please. So again, this is for information for the board. So in total, for the 2024 budget, we'll be asking for a capital budget of $5.4 million with future year cash flows of $2.3 $3 million with a total expenditure for these projects all combined of $7.7 million, just over 7.7. Next slide, please. I will be spending just a little bit more time on these next two. Last year, when I presented the 2023 budget, what we typically do is we do a continuity schedule where we start with what our approved budget is, and then we kind of go through all the changes. And so last year, I had presented sort of two views of what the budget would be, purely moving from what our 2023 budget was to what the 2024 budget. And then I presented what I called an alternate view if we were not responding to COVID-19, because that provides, I think, us with a better picture, and it doesn't dilute our budget in terms of what our true year-over-year pressures would be in the event that we were not, responding to a global pandemic at that point in time. So what you have here is that I'm showing that we've got a 2023 budget that was approved by the city, and then we've got some items here for in-year changes in terms of the budget. So the very first item you see is that we did see the province make a commitment for a 1% increase that actually starts in 2023 for us to the tune of $1 million. We also have continued on with our IOUT program in 2023. So we did receive some additional funding from Health Canada in 2023. So we're reflecting that. And in having the additional funding, they also extended the funding out into 2024. We also had, we had some salary and benefits in-year changes that happened as well, dealing with pay for performance, particularly for the non-unionized staff. And then what I've done here is I've basically backed out all the items that dealt with COVID-19, so we can take a look at the base programs or the non-COVID programs that Toronto Public Health provides. If you could just quickly go back to the previous slide, please. So I just wanted to note the TVIC, so the Toronto Voluntary Isolation Center, that program did wrap up into 2023. The TVIC closed out in March 2023. The School Focused Nurses, that program also has wrapped up, and it wrapped up on June 30th, 2023. And also we've removed the COVID-19 response, the lost revenues, which the province was covering. And those, of course, were revenues that we were not able to collect because the staff who were engaged in generating those revenues were continuing to be redeployed towards the COVID-19 response. And finally, the COVID-19 vaccination initiative as well. So next slide now. So what we're seeing is that you do have an adjustment for moving forward in terms of what the incremental changes will be for 2024. Because the injectable opioid agnostic treatment program, at this point, we only have agreement with Health Canada to continue that program to March 2024. What you'll see is an incremental reduction in terms of what is being provided. That being said, we will still have funding for 3 months to run that program into March. And we are in discussions with Health Canada about extending that program beyond March 2024. We've also recognized the increase in revenue again as announced by the province, and in keeping with prior years and through council direction, we have put an item in there for the student nutrition program cost of food increase. You'll notice it's $1.5 million. It's predicated upon an inflationary cost from July 2022 to July 2023 of 8.5%, and that is based upon the Consumer Price Index for Ontario for food. Finally, we also have our standard salaries and benefits incremental increases having to do with negotiated collective agreement settlements, as well as individuals moving along the pay grid in terms of pay per performance, both for union and non-union. And also we do have some just some technical adjustments that we need to have done predicated around increases related to interdivisional expenditures, as well as changes within our capital funding. So what you'll see here is that you see that year over year, generally speaking, I would look at the third column, that's the net expenditure column. So what we're looking for, or what we'll be requesting at this point in time, of course, this is subject to change, but we'd be asking for $7 million or a 9.7% increase from the city. And what that would basically does is that it keeps us at the same staffing level that we had pre-COVID, and it allows us to continue to run or deliver on our service levels as discussed at the Board of Health Budget Committee. And so it is a substantial increase. I think it's the largest one that we've asked for in the last 3 years. We've been running roughly around 5 to 6%, but we're close to 10%. I will note that in doing this, the majority of it, of course, is linked to the student nutrition program, but the larger portion is salary and benefits. And I want to note here that while we have recognized revenue of roughly $2.4 million from the province in terms of the announcement they made on August 22nd, that $2.4 million, when you look at the total amount that we need just to deal with salaries and benefits, it actually only accounts for 36% of the increase. So that is quite short of the 75% in terms of, historically has been the amount that the province has funded. So even though the province has provided us, with that annual 1% increase, to which we are thankful for, there's still, as Councillor Moyes indicated in his opening remarks, there still is a gap that we would like to encourage the province to fill. Next slide, please. In terms of our service levels, there was a presentation that was made to the Board of Health Budget Committee, and it is there. And in particular, if you're interested in the service levels that we will be bringing forward in terms of the 2024 budget, that is included in Appendix B of that presentation that was made. But I also wanted to point out something that that was made in terms of the announcement on August 22nd that I noted before in one of my previous slides. And that was the ministry's announcement that they would be working with partners to refine and clarify the roles of local public health units in order to reduce the overlap to services and focus resources on improving people's access to programs and services close to home. So I know a question that might be burning in everybody's mind is, what does that mean? And at this point, we are not 100% clear on exactly what that means. The ministry has indicated their intention to engage local public health units and to have conversations and have collaboration in terms of what that does mean, and we look forward to having those discussions with the ministry. Internally, we have started gathering information ourselves to see how we can best approach this and how we can best respond to the process that ministry will be bringing forward to us in terms of having this discussion. Next slide, please. Finally, we do have some recommendations that we're putting forward in terms of just recognizing the funding that has been provided by the ministry. And these recommendations are here so that the city is able to accept the funding that the province has put forward in terms of the 1% increase for 2023, as well as accept the funding for the capital project linked to the Ontario Seniors Dental Care Program. And that takes me to the end of the presentation. So thank you very much.
Thank you, Althea, Ms. Hutchinson. We have no deputants today on this item. Any questions from, okay, we do have a few. First, Councilor Bravo.
Thank you, Mr. Chair. Thank you so much for the excellent presentation. I wanted to just ask about, the 1% increase. Does that even come close to addressing the inflationary pressures that public health is facing? Let alone the need for increasing immunization, catch-up, and a whole bunch of other things we've heard about today.
So through the chair, it does not. If the province were to pay their 75%, we would be looking at having to have another $5.1 million in addition to the 2.4 that has been provided through the 1% increases.
And I note that as a result, for pressures like food price increases, it's going to have to be the City of Toronto that ensures that those school nutrition programs continue to be funded appropriately. Is that correct?
That is correct. The school nutrition program is a 100% funded program through the City of Toronto and has been historically.
The 25-75 commitment, considering that this government had originally wanted to go to 50-50, it is good news. But just another area I wanted to ask about, the increase proportionate, like for harm reduction. I see we come to a mid kind of risk level, but would you agree, or maybe someone else can comment, is that the scale of the crisis is actually so severe in municipalities, including the City of Toronto, that it seems like an area where not making sure that these programs are secure seems pretty risky to the cities. Yes.
Through the chair, I think I would respond with you are correct.
Okay. And then my final question was, I noted that you developed a kind of a matrix for assessing what would move forward. I saw that, I heard that maintaining pre-pandemic programming was a priority, and that programming would be assessed in relation to readiness and capacity. The risk level of the food handler program is quite high. Is this something that we would have to look at delaying for the future, considering the budgetary pressures that the city and Toronto Public Health is facing currently?
Through the chair, my comments about readiness and capacity spend has to do with capital projects.
Okay.
So that does not linked to the student nutrition program. Historically, City Council had put forward a request that every single year Toronto Public Health report to the council what the inflationary costs have been or will be for student nutrition programs. And historically, the city has provided 100% of that funding.
Sorry, maybe I'm confused. I thought the food handler program was the requirement for training and oversight and sort of certain conditions when it comes to events. Perhaps I misunderstood.
So,
sorry, my apologies.
Thanks.
So I'll
my apologies.
That's okay. Through the chair, Councillor, it is certainly a program that has been on pause during the course of the pandemic, but we have noted, and we're planning to come back to the board. There's, assessments with all programs ongoing right now. It seems that there have been other providers that have stepped into the fray and are providing this food handler education such that it is available. And my current understanding at this point in time is that, in fact, some of the other providers are providing a good service and can do so at a better cost. So we'll have a more fulsome explanation for the board, but it's certainly something that we're looking at. And we're looking at all of our programs to make sure that we're doing the best we can with the resources we have.
Well, thank you. Clearly, some tough choices need to be made, and I think it really helps to see the thinking and that you're taking into account the risk of public health not stepping in if there are other providers who can fulfill those objectives. Thank you.
That's correct. So through the chair, clearly, this board has had a long-standing practice of engaging in evidence-informed decision-making. We're certainly interested in making sure that you're aware of what the risks are that exist in respect of what's impacting health of Torontonians, and therefore looking at what makes the most sense to deliver. If there's a fixed basket of resources, which is of course always the case, how do we make sure that we're using the resources that are available to us in the best way possible, that gives us the greatest health possible, and at the same time also puts the onus on those parties where the onus belongs, right? There are some things where it is more rightfully healthcare, and that falls within the purview of the province. There are some things that are clearly perhaps more appropriately done by us, and there are some things that are done perhaps more appropriately by other partners. That's part and parcel of the advice that we give to you, regardless of what the program is, and you can count on us continuing to provide that level of service.
Okay. Thank you. Director Zhao?
Thank you. So my question is regarding the Toronto Drug Checking Service. Currently, this is one of the only services in Ontario that is looking at the contaminants in Toronto's drug supply, especially as fentanyl you're starting to see more harmful contaminants like carfentanil, xylazine, and things like that. As of April 2023, the funding for the Toronto Drug Checking Service has been cut. So I'm kind of curious, what category of the budget does that service fall under, and whether there will be any commitment to funding it again in the future?
So
Through the chair.
thank you for that question through the chair. I'm sorry, Upala, were you going to be taking that question?
You can, Althea, I can add.
Sure. I was just going to note that the funding that my understanding is the funding that was cut was actually through, it was the provincial funding. And the province did approach Toronto Public Health to ask if we could support through our existing budget for the supervised injection site, if we could continue to provide funding for that. So we have done that in 2023. And I'll turn it over to my colleague to talk about perhaps what the 2024 landscape might look like.
Through the chair again, my understanding is that the Toronto Drug Checking Service is currently seeking funding for the next fiscal year as well.
Okay. That's it? Okay, wonderful. Next on the list is Deputy Mayor Morley.
Thank you, Mr. Chair. Through you to staff. I know this is a difficult potential question, maybe some speculation required, but on the area around the ministry's announcement, working with their partners to refine and clarify roles of public health, reduce overlap. I imagine the legislation, and mandates are pretty clear, but I just wondered if staff could comment on what we understand currently as areas of overlap that may be important points of discussion as this comes forward.
So through the chair, we certainly have heard through various audits that have been conducted at the provincial level that there are opportunities for better collaboration. I can think back to a 2017 audit in respect of chronic disease prevention and health promotion. That was certainly an area that was highlighted in the Auditor General's report as an area where collaboration and more consistency across the province might be beneficial. It's not clear to me that that's definitely on the docket, but I think that looking at previous reports from the AG would be one way to think about what kinds of opportunities the province might be looking at, and certainly looking at lessons learned over the past 3.5 years of the pandemic would provide, I think, good fodder for the kinds of things that might be considered by the ministry. Again, we look forward to engaging in those conversations with our ministry partners, and we also recognize that we have an important role to play. We are the largest local public health jurisdiction in the province. We have some very unique concerns that frankly exist arguably only in the City of Toronto, and certainly we have volume considerations that most other jurisdictions don't have to even contemplate. So we will figure prominently in those discussions and make sure that our needs and the needs of Torontonians are well represented in those discussions.
Thank you, Dr. Davila. And I would just also highlight, I think it's always helpful, as we know we love data, we love information, and evidence-based decision-making is really what I think our residents expect of us. And I'm sure that will be importantly included as part of those conversations going forward. So thank you.
Thank you. Any other, okay, Councillor Perks?
First of all, thank you, Althea. Excellent as always. So if I see the from the presentation, the gross operating proposal at this point is 283, and 75% of that would be 212. Is the province offering us 212? Uh-oh.
Sorry, I was just conferring with my colleague in the room.
Yeah.
With me, and I'm hearing that no, we're not being offered 75%. The number we're being offered is is 135.6 million, and I'll have somebody do some quick math to figure out what percentage that is for you.
But it's not 75.
No, and the reason why is because over the last several years, the city has been providing almost 100, well, actually, they have been providing 100% of our cost increases with the exception of this fiscal year, right, where the province is contributing $2.4 million of the 6.7 that we actually need just for salary and benefits.
Okay. So I won't put you on the spot and ask you whether or not Minister Jones told the truth when she said they would pay 75%. I might comment on that myself. Thank you.
Thank you.
Okay, thank you. Up next is Trustee Sriskandarajah.
Thank you. Through you, Chair, I think the question has been asked, but I just want to confirm. So we're getting a 1% increase from the province. Is right? Yeah. But
Yes.
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 But with our current rate of inflation, is it fair to say that this is in fact a budget cut because we're not keeping up with the price of things? So will we be able to actually fund the things that we currently fund? Or will there be a decrease in services?
So why don't I take that question? Oh, sorry, Althea, why don't I kick things off and then I'll let you add further. So clearly you've heard both through Althea's presentation, the answers to the questions and what I'm about to tell you now that there are clearly, this isn't keeping up. It is certainly an improvement relative to what we might have anticipated, certainly in recent years, but there is clearly a challenge in respect of meeting the needs and keeping up with the costs as we understand them now. Of course, that presumes that a certain basket of services is still what's required. And so the caveat here is that, as my colleague Ms. Hutchinson has pointed out, there is this undertaking that the province has made around they plan to work with us and other partners, including other local public health units, to determine and to, I'll use their words, refine and clarify the roles of local public health units to reduce overlap to services and focus resources, et cetera, et cetera. So whether in fact this keeps up depends on what the basket of services is. And I think that's still a fundamental question that has yet to be really understood by us, and my sense is that I'm hoping that that's what we will be engaging in discussion with the province on.
Okay, so it sounds like we don't know yet if there will be reduction in services.
At this point in time, it all depends on what is the expectation in respect of services. How much money are we going to get? Is it sufficient to meet that service need? And then we can, sort through and delineate for you and the rest of the board, what does this mean?
Yeah. And through you, Chair, the capital costs, I know we're building or renovating a site. Have they been on budget, or are we, again, due to inflation? And I know at the school board, our construction has gone through the roof. So how are we anticipating that? Right? We don't want to get 6 months from now and saying we can't do this project because we don't have the money.
Althea, I think I'll let you speak to that one. You're probably better positioned to do so.
So thank you for the question through the chair. Very much so. I think capital cost or any kind of renovation costs have really been skyrocketing. We certainly are experiencing it at Toronto Public Health. And what we're doing is that we are in conversations with the ministry about our ability to tap into additional surpluses that the ministry has, because this is a program that I can say that they have been very committed towards providing adequate funding to. We also have been in discussions with the ministry about or sorry, not the ministry, but with the city as well, to see if the city has, because we do have some reserves within Toronto Public Health that were linked to previous dental clinics, whether or not we're able to access those reserves. I can say that, the conversations have been going very well on both fronts, so we will continue to push forward to get the funding that we have. And I would say, if I had to put a confidence level on it, I would say my confidence level is in the high 80s to maybe low 90s in our ability to get the funding. Yeah. So the conversations there, they've been very fruitful, I would say, at this point.
Thank you so much. That sounds optimistic, so I appreciate that. Thank you. That's all for me for now.
Okay, I think that was the last of the questions. Anyone else? Oh, Deputy Mayor Malik, go ahead.
Yeah, thank you very much. I just wanted to draw attention to the considerable change to the opioid agonist treatment program, and just to hear from staff about the impact that the program has. Myself, like a number of members of the Board of Health, have been able to visit the site and hear from frontline workers about what an important program it has been, especially as the only one of its kind in the city. So to speak a little bit more about its impact and the reason why we're seeing this considerable cut in the budget.
So through the chair, very briefly to answer the question, Deputy Mayor, you're absolutely right. This has been really a very welcome and much needed service here in the city. It is the kind of program, injectable opioid agonist treatment, has been used to great success in jurisdictions all over the world, and in many jurisdictions for many, many years. It is relatively new to us, but even in the short period of time for which we've had this program, we have seen its benefits. It is providing opportunities for people to, frankly, reconnect to purpose, to their lives that we've seen. I think when you came by to visit, we had the opportunity to tell you about some really great success stories, thinking about people who were first clients of the Works and our supervised consumption service. They then successfully move on to our injectable opioid agonist treatment program. And I think we told you about a client in particular who's gone on to enjoy good health, start a family, and done so very successfully. So certainly we're interested in continuing to have that opportunity to continue to provide that benefit, probably one of the most evidence-informed interventions we have in respect of managing people with challenges with substance use. So very, again, really interested in the conversations we're continuing to have with other orders of government around how can we continue to provide this evidence-informed service that actually provides good, good outcomes for Torontonians and Torontonians in particular who use drugs.
Thank you very much. That's very helpful. And can you just share with us a little bit more about where we obtained the funding from and what's happened to it?
So of course, through the chair, and I'll let Upala correct me should I misspeak, it is currently the program that we have in place is funded through the federal government. It was on a time-limited basis, and as you heard through Ms. Hutchinson's presentation, unfortunately, the time period is coming to a close. So again, we are in active conversations with our other government partners, seeking to find ways to ensure that you know, life-saving, health-promoting interventions are actually made available to Torontonians and hopefully to populations beyond Toronto. We know this is an issue that doesn't just affect Torontonians, it affects Canadians across this country. So we're hopeful that we will be successful in our conversations and certainly will continue to champion these important health services.
Thank you.
Okay, thank you. All righty, I think that's the last of the questions. We're moving to speakers.
Is there any chance that Althea's completed their math to find out the percentage that actually offering?
Althea, are you working your magic right now?
We're working through the numbers. As soon as I have it, I will provide it.
Okay.
Sorry about that.
No worries. Thank you so much. Okay, we'll move to speakers. Any speakers? Okay, I guess it's just me then. I do have a motion. Surprise, surprise. All right. So we alluded to it already throughout our conversation and through Althea's presentation. So the first one's really about asking council to increase the revenue to public health at $995,325 for operating budget. That money actually came from the Ministry of Health. And the second one is really to ask council to increase the public health capital budget by $589. Again, the money was sent through the Ministry of Health, and it's to renovate 160 Borough Drive. It's for Ontario Seniors Dental Care Program. The third piece here is a request to Health Canada to provide permanent funding for the injectable opioid agonist treatment program at a cost of $2.5 million beginning 2024-2025. The program is very important for its treatment and the drug toxicity crisis we have in the city. And so it's vital that the funding continues. So it's a request from us here. And lastly, in meeting number 4, earlier this year from this board, we talked about student nutrition programs. And I know Councilor Brapa was very passionate about this one item, if my memory serves me correctly. And so the demand continues, and especially around the cost of food, as we all know. And so we're asking the federal government to develop a national school food policy program to provide nutrition to children across the country, quite frankly. And part B of that is to ask the province to, and the federal government to fully fund breakfast and lunch programs to our students here in Toronto. So again, I think these are really important initiatives, and we need to put pressure on all levels of government. As Councilor Bravo alluded to, the province has $22 billion they're sitting on, and our students in the city are going hungry. And so I think it is important that we actually take care of our most vulnerable among us in our society, in our city, and students are part of that. So I do hope that my colleagues here will support these initiatives. Any questions at all? Director Zhao?
So just to clarify, the IOAT program also includes the Toronto Drug Checking Service as well, right? Or should we make that a bit more clear in motion number 3?
Okay, motion number 3. You want to speak to this? This is more your purview than mine.
So through you, Mr. Chair, no, the drug checking program is not included in this particular funding ask.
Is there a way to revise that third motion to also include it as part of that fund?
So that we could enhance this wording better, I am all open to that.
Okay.
I know you're a doctor in the field as well, and you're expert in these areas.
It
So
definitely, I think it should be included, because right now it is the only service in Ontario to provide drug checking.
So if you have any recommended wording or change, I'm happy. We could take a pause for a moment. Yeah, bring it. We'll just pause for a moment while we just get some wording. Yes, a washroom break would be nice. 2 minutes. Well, we're in breaks. Okay, we're gonna resume, but before we, so Althea has those numbers for us, so, during the commercial break. So Althea, you're up, let's go for it.
Yeah, so the percentage that Councillor Pearce was asking for through the chair, it's 73%. That would be the amount, it's 73%. And this would be after, I want to just little caveat, this would be after, the city provides the 10% increase that we're requesting in the 2024 budget.
Okay. Okay.
Thank
awesome.
you.
You will put it up? Okay, I know we don't do it. There we go. All right, so we're good to go. So we've added a new number, and so I'm gonna put it as a friendly amendment. Even though we don't do friendly amendments here, I'm still gonna say that anyway. But thank you, Dr. Zhao. You're a director, but you're also a doctor, so thank you, Dr. Zhao. So the item that was added was the Board of Health, Right to Health Canada, and the provincial government to request that they provide permanent funding, 1 million beginning in 2024-25, adjusting to inflation for the Toronto Drug Checking Service. So that's good? All right, awesome. I love the teamwork here. Go ahead, Derek.
Just want to make sure we get it right. When we say permanent funding at $1 million, do we want to include the word annual? I guess that would be the annual funding, or is it just permanent funding for the upcoming year?
We talked about that, and we decided to just word it as is.
Okay, all good. Just wanted to clarify. Thank you.
Thank you. All righty, seeing no further questions. Go ahead.
The dollar figure is still in question. Sorry.
The dollar figure is still in question.
Sufficient funding to run, again, it's your motion, sir,
Yeah.
but I just don't want to undercut the dollar figure.
Okay. Okay, well, okay.
So
Well,
we're just trying to get that.
And do you want to say permanent funding then, or do you want to say sustainable or sufficient, or just don't want permanent?
Okay, we made a slight amendment. Too many doctors and educators in this room. It's helpful, yes. Dangerous, yes. Yeah, the clerk appreciates it, though. All right, so what number is that, 4?
Oh, hold on. You could represent the letter of the actual amount.
Okay.
Oh.
Once we know the number.
When we send the letter to the feds,
Okay.
will we clear out how much?
So what's
All righty, we perfection it. So again, just with a slight change, the Board of Health writes to Health Canada, the provincial government, to request that they may provide sufficient and ongoing funding adjusted to inflation for the Toronto Drug Checking Service. There you go, that sounds good. All those in favor? All those opposed? As amended? Opposed? Carried, thank you, that's carried. Excellent. So we'll need to do a motion to extend. I'm going to put the motion up, and it's going to be moved by Deputy Mayor Morley.
Thank you, Mr.
That'd be wonderful. Thank you.
Yeah, just give us one moment.
There we go. A motion to extend. All those in favor? All those opposed? Carried. Thank you. Next item is item HL 6.3, COVID-19 vaccine distribution to Toronto healthcare providers. Dr. Davila, you want to introduce next presenter?
Thank you, Mr. Chair. Last presentation for today, and I see my colleague, Dr. Lamptey, is just coming up to the presenter's desk. She'll take us through this presentation quickly, and hopefully, with the extension of the meeting, we won't keep you for too much longer. So over to you, Dr. Lamptey.
Thank you, Dr. Davila. Good afternoon. As you recall, I'm the Deputy Medical Officer of Health, responsible for overseeing decision support, surveillance, and immunization here at Toronto Public Health. I'm pleased to present this short slide deck on the status of Toronto Public Health work to coordinate the management and distribution of COVID-19 vaccines in Toronto. We've also included information about vaccine management in Toronto broadly, and a little bit about current epidemiology and the COVID-19 vaccination program. Next slide, please. Before the COVID-19 pandemic, there were two pathways for obtaining non-COVID-19 vaccines in Toronto for vaccinators and their organizations. Here on the left, you can see that routine vaccines like influenza, measles, mumps, rubella vaccine, or shingles vaccine can be ordered by healthcare providers and organizations directly from the Ontario government and Medical Supply Service, which we really usually refer to as OGP, or the Ontario Government Pharmacy. Providers order these vaccines from OGP and get their deliveries from OGP couriers. Toronto Public Health is not involved in any part of that process. On the right, you can see there are some vaccines that are covered under what's called a high-risk program, as well as a school immunization program for specific populations, like human papillomavirus vaccine and hepatitis B vaccines. These are also available to providers from OGP, but providers place orders through Toronto Public Health. Toronto Public Health then approves these orders and places them with OGP, who delivers the products to the providers. The pandemic for COVID-19 required substantial logistics and delivery infrastructure to provide vaccine access to all of Toronto's communities. Toronto Public Health worked with the Ministry of Health and Toronto hospitals to get vaccines into communities quickly through multiple channels, pharmacies, hospital clinics, city-run immunization clinics, and long-term care settings, all of which became known as the Team Toronto approach. We acknowledge the incredible work by our partners, including hospitals across Toronto throughout the COVID-19 pandemic, and the important work they led to support the city's COVID-19 response. Just as a reminder, during the pandemic, Toronto Public Health created a vaccine depot for logistics, distribution, and inventory management for our city-run immunization clinics. Hospitals managed their own logistics, distribution, and inventory directly with the Ministry of Health, and then the hospitals helped Toronto Public Health logistics and distribution for early healthcare provider adopters of COVID-19 vaccine. Later, Toronto Public Health entered into an agreement with Ministry of Health to obtain assistance from a third-party vendor for logistics and distribution of COVID-19 vaccines to healthcare providers and non-hospital, non-pharmacy health settings to reduce hospital workload. So in short, from January 2021, hospitals were ordering vaccines directly from the ministry, and the Ministry of Health supported Toronto Public Health with delivery logistics to healthcare providers from July 2021. Then in March of this year, 2023, the ministry requested that Toronto Public Health take over these two parts of the program. This is unique in Ontario. Toronto Public Health is the only health unit that does not manage inventory, logistics, and distribution of vaccines routinely for providers in healthcare settings. Next slide. So as you recall, as we came to report to the Board of Health earlier this year, in March of 2023, the Ministry of Health, through the Chief Medical Officer of Health, requested that by April 1st, 2023, Toronto Public Health take responsibility for the management of inventory, logistics, and distribution of COVID-19 vaccines in Toronto for all health settings, including hospitals, long-term care, and healthcare providers. This means that the request essentially asked us to take over hospital COVID-19 vaccine ordering, distribution, and some inventory, to consolidate logistics in Toronto for everyone under Toronto Public Health, and then also manage inventory and requests for vaccines for the region. If you can go to the next slide, please. In April 2021, when Toronto Public Health started sending COVID-19 vaccine to providers in the community, there were only 13 providers enrolled. Since then, with assistance from the ministry and an external logistics and delivery vendor, 320 community providers have enrolled in the program. Together, these providers in these settings have administered over 200,000 COVID-19 vaccines. These are significant alternative channels for vaccination from the mass immunization clinics or pharmacy models, so they have helped expand access and choice of provider for the public. As we continue to the fall, we know that providers are going to be relying on efficient logistics to run successful vaccine clinics. Toronto Public Health requested funding for sustainable resources for this initiative as part of the 2023 Annual Service Plan and Business Submission to the Ministry of Health. On August 22nd, 2023, Toronto Public Health received the Public Health Funding and Accountability Agreement from the Ministry of Health. This agreement did not include specific funding for this provincially requested vaccine distribution initiative. Next slide, please. In short, in terms of a description of what we understand of the COVID-19 viral activity in our area, in Ontario, as of August 31st, 2023, Ontario case counts and percent positivity had doubled over 6 weeks from July through to August 19. However, case counts remain low overall. The recent increases in case counts are not comparable to previous surges of 2020 through 2022, because we're starting from a very low base, so even a doubling still takes us to a much lower level than when we've experienced previously. Toronto case counts and outbreaks are currently low and stable. However, percent positivity is increasing. Toronto wastewater signals remain low and stable. And Toronto and Ontario hospitalizations, ICU admissions, and deaths from COVID-19 are low. If we can go to the next slide, please. Now, some of you may have questions about variants of interest. We know that COVID-19 is a virus that has changed frequently since it first emerged. Currently, there are 2 variants of interest that are being monitored. One, called EG5, and its sublineages, has recently become the dominant variant of interest circulating in Ontario and in Toronto, where it constitutes about 32.6% of confirmed cases. Because we have seen that variant increase, it suggests that it's potentially more transmissible and immune evasive. And we also are aware that BA2.86 has more mutations than other variants of interest. But our experience with it is still fairly new. Similarly, it could be more transmissible and immune evasive. But right now, there has been no evidence of increased severity associated with either variant. The first case of BA2.86 was detected in British Columbia very recently on August 29th, 2023. So with that, I'll conclude my presentation. Hopefully I managed to be brief.
Thank you, Dr. Lemty. Any questions for Dr. Lemty? Trustee Srishkundarajah?
Thank you.
Oh, sorry. One moment. We do have a deputant, so I'll ask the deputant to come forward. Derek Morin.
I just want to say by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied in doing so as fraud. God bless His Majesty the King. Long live His Majesty the King. Let the record show that I do not consent to the warrantless searches taking place downstairs by the corporate security T-shirt police here at Toronto City Hall. So something called the Canadian Independent posted this on Twitter. just yesterday from the NCBI, National Center for Biotechnology Information site. I had the link in my written presentation. The title of this study is ironically, Inability to Work Following COVID-19 Vaccination, a Relevant Aspect for Future Booster Vaccinations. It says, vaccine-related inability to work among healthcare workers could overstrain healthcare systems. Among 1,704 healthcare workers enrolled, 595, 34.9%, were on sick leave following at least one COVID-19 vaccination, leading to a total number of 1,556 sick days. Both the absolute sick days and the rate of healthcare workers on sick leave significantly increased with each subsequent vaccination. Now they're comparing two different mRNA gene therapy shots here, but the difference in sick leave was not significant after the second dose, but mRNA-1273 induced a significantly longer and more frequent sick leave after the third. Their conclusion was, in the light of further COVID-19 infection waves and booster vaccinations, there is a risk of additional staff shortages due to post-vaccination inability to work, which could negatively impact the already strained healthcare system and jeopardize patient care. These findings will aid further vaccination campaigns to minimize the impact of staff absences on the healthcare system. Another thing the Canadian Independent posted on Twitter the other day was, as a result of a court order, the South African government was forced to disclose to the public the contract they entered into with a COVID vaccine maker. On page 21 of the agreement, it says, purchaser acknowledges that the vaccine and materials related to the vaccine and their components and constituent materials are being rapidly developed due to the emergency circumstances of the COVID-19 pandemic and will continue to be studied after provision of the vaccine to purchaser under this agreement. Purchaser further acknowledges that the long-term effects and efficacy of the vaccine are not currently known, and that there may be adverse effects of the vaccine that are not currently known. You mean there's adverse effects from the COVID vaccines? No way. Really? You're joking me. And the title of this agreement on its cover page says, Manufacturing and Supply Agreement between Pfizer Laboratories Proprietary Limited and the Government of the Republic of South Africa acting through the National Department of Health of South Africa dated as of 30th March 2021. Now this is a letter from a healthcare provider to Premier Ford. His name is Dr. Richard Shabbos. He says, I served as Ontario's Chief Medical Officer of Health from 1987 to 1997. I helped train many current medical officers, including Dr. Williams, and was Chief of Staff at York Central Hospital during the 2003 SARS crisis. Now, it's a very long letter here, so I'm going to skip to the bottom here. He mentioned that the government has resorted to fear-mongering to encourage compliance with lockdown. An excellent example is in the government's response to Mr. Roman Baber, who was an MPP at the Times letter. Instead of addressing his point about COVID infection fatality rates, the IFR, the government cited COVID's reported case fatality rate. Every knowledgeable observer of COVID understands that CFR is in itself an irrelevant number. The infection fatality rate is the meaningful measure of virulence. CFR's only virtue is its ability to frighten by overstating the real risk of dying from a COVID infection. I can think of no other reason for the government to cite CFR except to promote fear. And I forgot to put this in my written presentation, but I mentioned this at the police board meeting recently. This is a Freedom of Action information request from the Canadian Independent again, where he asked for a copy of all records from serious adverse events, injuries, and deaths related to any of the COVID-19 vaccines. And I guess Christy Pratt, Deputy City Clerk, said, sure, no problem. But we'll only do it for the low, low price of $37,140. And as a great Torontonian out there named George Sawissian said, you know it only costs $37,000 because there's got to be some sort of form of criminality in there somewhere.
Thank you. Any questions for the deputant? Seeing none, thank you for coming to be today. So, Dr. Lamptey, you can stay where you are and take questions from there. So far, I have Trustee Sriskanaraja, Deputy Mayor Morley. Anyone else? Okay, go ahead, Trustee Sriskanaraja.
Thank you, through you, Chair. I just wanted to get a bit more background on why there's certain vaccines that are ordered through the provincial government and certain vaccines through public health.
Through you, Mr. Chair. I think I'll start by saying I actually don't know what the reason for that. I think it's historical developments on the unique aspects of Toronto's size. We have thousands of providers, and so it's actually quite complex to be able to store, manage the inventory, and then distribute vaccine. And the Ontario Government Pharmacy is not far from our borders. It's another jurisdiction, but it's close. But I'll stop there and see if Dr. DeBell has anything to add.
Through the chair, the COVID vaccine was a relatively new vaccine and was picked up by the province because they had always managed our vaccine distribution here in the city of Toronto. That has been one of the unique characteristics for us in Toronto Public Health. In other jurisdictions, it is managed more at the local level. And I think the size and scale of the operations is certainly part of the reason. I don't pretend to, be completely attuned with the decision-making process that happens at the provincial level, but suffice it to say that they have provided this service to us on a long-standing basis. This new development in respect of COVID, because it was a new vaccine, I think that's, again, and it's a very specific set of vaccines. They had the hospitals originally distributing them, and as you just heard through Dr. Lamptey's presentation today, they had asked us, and we have brought this before to this board, that they have asked us to take this on at this point in time. So the history has been such that given the size of our city and the scope of the work, this has been something that the province has traditionally taken on for us.
Thank you. And for the vaccines, through Chair, that we do distribute, do we get funding that's earmarked just for that, or do we just, it comes out of our general budget?
So I'll answer that in two parts. So currently for the COVID-19 vaccine, the distribution that we're doing currently in this year of 2023 is the...
Sorry,
Sorry. Is that better?
Yes.
My apologies. So through you, Mr. Chair, I'll try and answer in two components. So for the COVID-19 vaccine that we're distributing in this year of 2023, it is funded provincially through, or reimbursed, I should say, through COVID-19 extraordinary funds. We have not gotten any specific allocation of that funding being assured upfront for 2023. And then for 2024, we would have to, again, submit a request to ask for funding for that. Now, for the vaccines for the high-risk program, it is incorporated into our immunization program budget that we manage the orders for those high-risk vaccines. Now, I would say the volumes for those are a completely different scale than, for example, let's say the routine childhood vaccines. And again, if you, if I can just go back to the slide, we help manage the orders, but the actual distribution to providers in the high-risk program still comes through the province from the OGP. So we're not physically storing those vaccines for the providers.
Thank you. So, and you might not be able to answer this question because it might be a political answer. So if you don't feel comfortable, I understand. Would you say that the government is downloading this responsibility on us, or do you think that you feel public health should be overseeing this, or will our resources be better spent elsewhere if they could be overseeing this?
So through the chair, I think the question as to whether there's a download here or not all depends on what resources come along with. Again, these things are really all about, are there sufficient resources to manage the work? So to my mind, that's an open question. And as you heard from Dr. Lamptey, we will put requests forward for, when new requests or new workload is required of us, new service, whatever it is required. My sense is that, what's needed is the resources to actually make that doable. And in some cases, it's relatively easy to deploy that. In other cases, quite frankly, it is more challenging. Logistics infrastructure and that kind of thing is not something that's actually developed overnight. So I think there's certainly room for discussion when it comes to programs like this, whereas with other programs, it might actually be easier to just simply say, here's some money, acquire the staff, deliver the service. This one's a little more complicated than that, so I think that will require a little more conversation.
Thank you.
Okay, Deputy Mayor Morley?
My questions have been asked and answered. I'll just speak and say a couple of words. Thank you. When we get there. Thanks.
Okay, great. Again, Srishkan Raja did ask my question, but thank you. So do we want this extra responsibility? And can we say no? Well, just to pick up on Trustee Srishkan questions around this new distribution that, has been downloaded to us. We don't know. We know that we need to vaccinate people soon, this fall. We don't know what funding comes with it. We don't know if we have the capacity to actually do this new responsibility. I mean, do we have the staffing for it? So there's a lot of unknowns, and I feel like this decision will happen in a very short period of time. So again, and I know public health has a lot on its plate already, and the more I'm here and working in this role, I'm always dumbfounded by how much work that they do every day. And this is just something that's put on the side of their desk now to add to their responsibility. So I'm saying that, do we want this responsibility, or are we able to say no? Those are my thoughts.
So through you, Mr. Chair, a couple of things. One, I think logistics and distribution isn't necessarily core, what I would characterize as core public health. I think ensuring that there are mechanisms by which vaccines are made available to providers and therefore to the public is important. And I think that as long as there are resources and that they're actually doable, that we can actually, that we get funding and that we're actually able to get the resources to properly deliver the service, then that's one thing. So I think right now, my sense is that we do have, we're working on this and doing this under funding that's been provided to date. There are some questions on the go-forward basis, and I think that there is certainly the support of the board to ensure that the resources we have are being used for the most valuable activities and endeavors would be most welcome. I think I'll leave it at that for now, recognizing that it's a more complicated question, particularly if we are talking about the broader range of vaccines.
Okay, thank you. Those are my questions. Speakers, Deputy Mayor Morley.
Thank you, Mr. Chair. I just wanted to add my voice to this conversation as we navigate our budget process, as we navigate significant budget pressures. We just last week, you all will be familiar with our emergency meeting to discuss a long-term financial plan for our city. And one of the principles of that plan is to stop digging a hole or stop sort of digging into areas and making commitments and taking on expenditures, especially in areas that fall outside of our purview as a municipality. And so I just want to put that forward very clearly and on the record as we continue to work hard to advocate and advance a new fiscal deal with both our provincial and federal counterparts. We have an untenable situation right now. And just over the weekend, being out in the community, speaking with residents and their concerns around a municipal sales tax in the midst of an affordability crisis, our ongoing and very acute multiple crises that have been born largely out of the pandemic and the challenges that have arisen through that. And so I think it's really critical if and whenever we are being asked to take on more responsibilities that fall squarely under the purview of one of our other orders of government, that we're very strong in those negotiations. To the point of Dr. Davila, it's an open conversation, but I think we need to be very clear and very direct about what our needs are, what the costs associated would be, and how folks are going to need to make us whole in order for us to take on additional roles and responsibilities as it relates to the provisions of healthcare and these pieces in the province. And so those are my comments, and I look forward to these ongoing conversations. It sounds like the provincial government still has a ways to go to meet their 75% of our general operating dollars for public health, and this sounds to me like it represents a significant additional piece of work that no doubt will have associated costs. So thank you. Those are my comments.
Thank you so much. Seeing no other questions, I need a mover for this item for receipt. Deputy Mayor Morley, all those in favor? All those opposed? Carried. And that concludes our business for today. Thank you, everyone, for being here today, staff and directors, and we'll see you next time. Have a good day. Thank you. Thank you.